Okay, thank you. Thank you. Hi everyone. Good evening. Okay, hi everyone. Good evening. So today I'm going to continue the FMG Accelerate session brought to you by PW MedEd. Yesterday we discussed 30 questions and today I have almost 30 questions more to go. The PDF of yesterday's session will be uploaded on the PW MedEd app. PW MedEd app. All right, link the link for the app is there in the description of this video. Please check it out. Chalo. Okay, we'll start with question first. Thank you, Shoaib. Means a lot. Chalo, first question of the day. Question number 31. 30 questions we did yesterday. Okay. Now, which can cause condyloma acuminata? HPV 1 and 6, HPV 16, 18, HPV 31, 33, or HPV 6, 11? Now, what do you think is the answer? HPV is what? HPV is human papilloma virus. Yesterday, I told you the names of the DNA viruses as happy viruses, and I told you that if you remember the names of these happy viruses, by default, all the other viruses in virology are RNA viruses. So, can you tell me today which virus is this? DNA virus or RNA virus? That's what my question is. Good evening, MedPsycho. Okay, guys, DNA virus it is or RNA virus? Quick, excellent Jart Life DNA virus it is. Okay, now this human papilloma virus. Okay, few words about it. Remember, it's an example of a non-cultivable virus. Non-cultivable virus. Yesterday, I told you the names of non-cultivable fungi also. Okay, let's revise a little bit what we learned yesterday and try to I'm sure at least 50%, 40 to 50% of what I'm going to talk today you will remember like that only. And to make the maximum use of this session, I would request you to check out the PDF uploaded on the PW MedEd app and just review the video in 2x speed once again. Okay, whatever extra, whatever you feel is extra for you, like which you didn't know before, that you can just add. Okay, so it's an example of a cultivable virus. Yesterday I told you the names of non-cultivable fungi, that is Pneumocystis herovesii and other one is Rhinosporidium seaberry. So human papilloma virus is also a non-cultivable virus. And another example of a non-cultivable virus is molluscum contagiosum. All these are MCQs. Molluscum contagiosum virus. This virus, molluscum contagiosum, also is a DNA virus. It's a pox virus. All pox viruses are DNA viruses. Okay. Now coming back to the human papilloma virus, accepted abbreviation is HPV. You can classify this virus into different genotypes, that is the low risk genotypes and the high risk genotypes. What risk are we talking about over here? The risk of cancer. Okay. Now the high risk genotypes, remember two most important genotypes are, remember, sweet 16 and 18, the age to vote. Okay. Others are also there like 31, 33, 35, but at least you have to remember 16, sweet 16 and 18. Okay. So risky ages, high risk genotypes are 16 and 18. Low risk genotypes also many are there, but the ones which are most important are 6 and 11. And as rightly answered by most of you, this question which is asking you what is the cause of condyloma acuminata, answer is option D, that is HPV 6 and 11. HPV 6 and 11 causes condyloma acuminata. Alright, what are these? These are the genital warts. These are the genital warts caused by HPV seen in both males and females, and these are sexually transmitted. Alright. Okay guys, so I have put up a picture just to tell you how these warts are formed. By the way, what are warts? These are proliferative lesions. So let us see how genital warts are going to form. Now imagine, okay, this is the virus, it's the schematic representation. The HPV invades the skin. Okay, so this blue satellite kind of a thing is the HPV. It has invaded or infected the skin cells. The DNA from the virus enters the skin cell. Okay, now HPV causes infected skin cells to multiply and form warts. So this is a wart. You can see this proliferative lesion, and this wart is going to be shedding the virus, and the virus can be transmitted to others. So remember, in case of HPV virus, the infection occurs by sexual transmission and by direct contact also. There are warts known as common warts which are seen in other areas of the body apart from genitals, and the mode of transmission is direct contact. And that is why it is emphasized so much that proper hand hygiene should be maintained, and the inanimate objects around us, they should be disinfected routinely, because this virus and so many other microorganisms have got a predilection or attachment or affinity or love for these non-living objects. They survive on these surfaces, on the surfaces for different time periods, and that is why. All right, see, I'm gonna stick to English because, see, you have to give your exam in English. The textbooks are going to be in English. The app lectures are going to be in English. All right. If you want me to repeat something, I will repeat it. One or two words here and there, if I by default happen to say in Hindi, that's a different thing. But everything, all the teaching is going to be in English. Okay. And if at all I happen to say some example or give you some analogy in Hindi, don't worry, I will translate that into English. But overall, it is going to be English only. Okay, guys. So is this clear? This is how genital warts are going to be formed. Okay, now look at this. Genital warts by human papilloma virus. So these are the genital warts, as you can see, found on the shaft of penis, vagina, vulva, cervix, and around the anus. Most welcome, Vignesh. Okay, genital warts, condyloma acuminata. Okay, another question for you. Tell me, condyloma lata is seen in which condition? Condyloma lata is seen in which condition? Condyloma lata is seen in, guys, secondary syphilis. Secondary syphilis. What are these? Condyloma lata also are genital lesions. These are multiple painless genital lesions. In primary syphilis, you get a single painless genital lesion. In secondary syphilis, which is a generalized infection, there are multiple genital painless lesions known as condyloma lata. Okay, good, Vignesh. All right. So far what I have told you, HPV, it's an example of a DNA virus. It's a non-cultivable virus. The genotypes are of two types. The low risk and the high risk, depending on the risk of cancer causation. And the genital warts are formed in this way. Is this clear? Any doubts? Anyone? Okay, next question. A child presented with complaints of dysphagia, cough, grayish white membrane over the tonsils. Which of the following is the causative agent, causative organism? Okay, this we discussed, some aspect of this organism we discussed yesterday also. So what do you think this is? Clostridium or Corynebacterium diphtheriae or Candida or Pneumococcus? Okay, med psycho, very good. Okay, guys, it is a straightforward question. See, as I said yesterday also, diphtheria is a favorite of examiners, especially in FMGE exam. Few, they love to ask some certain bacteria specifically, and diphtheria is one of them. Okay. Okay, so a child presenting with dysphagia, cough, grayish white membrane over the tonsils. Remember, yesterday I told you the most common type of diphtheria is what? Faucial diphtheria. Okay, faucial diphtheria. Okay, guys. Okay, a couple of things I would want to tell you today, regarding this organism. Remember, the most important virulence factor, VF is virulence factor, or the arm and ammunition of this organism is what? It is diphtheria toxin. It is diphtheria toxin. Now, this is an exotoxin. As a rule, all the exotoxins are what? They are proteins. Now, protein comes from what? Protein comes from mRNA. mRNA comes from gene. And life is what? Life is nothing but proteins. Now, the gene for this proteinaceous toxin is not the sole property, is not the property of this organism, that is this bacterium. Instead, this gene, the gene for this toxin, is a gift which this organism is going to get once it is attacked by a specific kind of phage or virus, namely beta phage or corynephages. Okay, so there, what are phages? Phages, also known as bacteriophages, they are nothing but viruses which attack bacteria. So there is a phage, namely beta phage or corynephages. It has got the gene for DT, diphtheria toxin. The accepted short form for this toxin is DT, that is diphtheria toxin. Now what happens is, when Corynebacterium diphtheriae gets attacked by this phage, then as a gift it transfers this gene to the organism, to the bacterium, and then this gene is expressed and then the toxin is going to be produced. And this phenomenon, so what is going to happen? There is going to be a change in the life of this bacterium who has now acquired this toxin. Okay, the life is going to be life is going to change totally, not just of this bacterium but also the life of the individual, the human being whom it is now going to infect. Remember, diphtheria is a toxin mediated disease. So remember, okay, this phenomenon of the bacterium acquiring this gene for the toxin from the phage is known as lysogenic conversion. Now this bacterium has been converted, it has undergone what is known as lysogenic conversion. All right, now remember, if this does not happen, that is the phage is not infecting the organism, the bacterium, so there is no acquisition of the gene, then there is no expression of the toxin also, so no diphtheria. So please remember strictly, diphtheria is a toxin mediated disease. It is as good as saying if there is no toxin production, there is no diphtheria. No diphtheria. It is the toxin who is the culprit. The toxin is going to invade the bloodstream, and the toxin has got affinity or love or attraction for some things. Like for example, it loves man. Of course, it is going to infect humans or man. But what I want you all to remember is M stands for myocardium, A stands for adrenals, and N stands for nerve endings. Okay, so this toxin is going to enter the bloodstream, and it will happily swim or circulate in the blood and go on to infect all of these. The organisms, on the other hand, are going to be localized. Like in fascial diphtheria, the most common type of diphtheria, in the throat, we take throat swab for making a diagnosis, right? So in the throat, the organisms are going to be localized. They will remain there only. They will keep on producing the toxin. The toxin obviously is going to act locally on the respiratory, on the epithelial cells, and additionally the toxin is going to enter the bloodstream. So diphtheria is not a systemic infection. Diphtheria is a systemic disease, thanks to the toxin which is circulating happily in the blood. So it's a systemic disease and not a systemic infection. Blood culture is going to be positive or negative? There will be negative blood culture, because organisms are not going to jump into the bloodstream. Okay, so remember, diphtheria is a toxemia, okay, and not a septicemia or bacteremia. Is this clear? This is very, very important. So what is going to happen in the throat? In the throat, where the organisms are there and they are producing the toxin, there is going to be what? There is going to be damage. There's going to be, it's going to be a battlefield where two teams are fighting. One is our immune system, and the other is the bacteria and the toxins. So the bacteria are going to damage the, they're going to damage the epithelial cells via the toxin. It is the toxin actually which is going to affect the epithelial cells, and the toxin is being produced by the bacteria. Okay, so whenever tissue damage occurs, what is the first response of our body? The first response is inflammation. So in the throat where this damage is occurring, there is going to be present an inflammatory infiltrate also. Inflammatory infiltrate bringing in neutrophils followed by other cells like monocytes and all, and there's going to be a fight between these inflammatory cells and the bacteria, and there's going to be lot of dead B for bacteria, dead epithelial cells, and dead inflammatory cells. All of them are going to form a membrane in the throat. Okay, it is going to be known as pseudo membrane. Why it is called as pseudo membrane? What is so false about it? What is so wrong about it? Remember, pseudo membrane, it's just a membrane made up of all these dead things, plus of course there is fibrin and a layer of RBCs also additionally. Okay, so it's not a true membrane. Like tympanic membrane is going to compartmentalize the ear, dividing it into compartments. This is a pseudo membrane. It is not going to divide. It is not going to act as a division or a barrier between something and something else. That is why the genesis of the name pseudo membrane, having the appearance of washed leather, which means diphtheros. Hence the name diphtheria. Diphtheria. Okay. Yes, absolutely, med psycho. Act like true, but it is not true. Okay. Now, this pseudo membrane, it bleeds on removal. It bleeds on removal. If you are if you do the oral examination of someone and you see some membrane, you are suspecting it to be a case of diphtheria. Do not ever try to manipulate the membrane, because the membrane is going to bleed on removal, and the membrane, if it detaches, it can detach and block the respiratory passage, leading to what? Lead into asphyxia, and the patient can even die. That is why diphtheria in Hindi is known as what? It is known as gal ghotu. Asphyxia, I mean, in Hindi it is called as gal ghotu. Let me just write it in English only. Gal ghotu. Is this clear? Is this clear, guys? All right, next question. An Rh negative mother had an Rh positive child. This Rh incompatibility is which kind of hypersensitivity reaction? Anaphylactic, cytotoxic, immune complex mediated, or delayed? What is so new about it, med psycho? New as in? Okay, guys, what is this? Few basic things I told you about hypersensitivity yesterday. So Rh negative mother had Rh positive child. Rh incompatibility. Rh antigen is there on the RBCs and it is being destroyed by the complement activation because of because the antibodies are against the Rh antigen have attached to the RBCs. So the antigen is fixed, antibody is free. So it comes under which kind of hypersensitivity reaction? Cytotoxic. Okay, very good, Vignesh. Type 2, that is cytotoxic. Type 2, very good. Now other examples of type 2 other than Rh incompatibility, remember ABO incompatibility. Okay, then drug induced hemolytic anemia. So all the conditions where the cells the blood cells are undergoing lysis, most of them are type 2 hypersensitivity. Drug induced hemolytic anemia, drug induced thrombocytopenia. Okay, ABO incompatibility, Rh incompatibility, then acute rheumatic fever. Now, any peculiar examples of type 2 hypersensitivity where the cells are not getting destroyed? On the contrary, the cells are either overactive or underactive. See, excess of everything is bad. Overactivity is also bad and underactivity is also bad. So let me write two more examples of type 2 hypersensitivity where the cells are not actually getting destroyed but there is overaction or underaction. Overaction example is Graves' disease. And underaction example is myasthenia gravis. Any famous film personality who has had who has suffered from myasthenia gravis? A legendary actor of our country. Yes, absolutely right, Vignesh. I'm Mr. Amitabh Bachchan. Okay. Okay, guys, next question. Owl's eye appearance of cells in urine examination of post kidney transplant patients is a feature of. They already have mentioned the biggest clue in the question, typical appearance or owl's eye appearance. Silent Dr. Bigby, yes. Not HSV, it is neither HHV, that is human herpes virus, not Epstein-Barr virus, but cytomegalovirus. Cytomegalovirus. Cytomegalovirus is the largest herpes virus. This is the largest herpes virus. Overall, the largest viruses are pox viruses. Remember, in general, we say herpes viruses. Herpes viruses, they range somewhere between 120 to 200 nanometers in size. These are the second largest viruses overall, and amongst all the herpes viruses, the largest one is cytomegalovirus. The name itself says cyto, remember, megalovirus. Cyto means cell, megalo means megali. Okay. Hi Radha. So basically this virus is going to cause megali or enlargement of the infected cells. Okay. Good evening Radha. Now look at this. So cytomegalovirus, why this virus is so special? The reason is, remember, a famous MCQ is, which of the following viruses produces both intranuclear as well as intracytoplasmic inclusion bodies? Okay, so the inclusion bodies, both see, there's a general rule. Okay, let me just write the general rule first. See, the DNA viruses, the DNA viruses which multiply in the nucleus, they usually produce the intranuclear inclusion bodies. Exception is except the pox viruses. Pox viruses. Now I'll just give you a little memorizing tip over here. Pox viruses are said are the largest viruses. Okay, they are the largest viruses. Now imagine these viruses are so big that they have got a problem in entering the nucleus. They will stay back in the cytoplasm. So remember, pox viruses are going to induce the formation of intracytoplasmic inclusion bodies. This is an exception, and all exceptions are obvious questions for any exam. Okay. Good evening, Sodharam. Okay, so this is first rule regarding the DNA viruses. Then the second rule I would want to tell you is RNA viruses. RNA viruses, they usually multiply in the cytoplasm, so they generally produce intracytoplasmic inclusion bodies. The exception is, except, this again is a question, which RNA virus produces intranuclear inclusion bodies. It is yellow fever virus. Yellow fever virus, it produces the inclusion bodies, namely Taurus bodies in the hepatocytes. These are intranuclear. Okay, these are intranuclear inclusion bodies. Okay, now another question, in this context is viruses which induce both intranuclear as well as, one second, viruses which induce both intranuclear and intracytoplasmic inclusion bodies. These are very hungry viruses. They are not going to be satisfied by either nucleus alone or cytoplasm alone. So these viruses include, one is measles virus. Measles virus. Now there's a reason why I have written capital M, capital E. Now this, I personally feel, this is a very egoistic virus. This is how I used to remember this as a student. This virus, it's in its name itself has got me. So it's very, what to say, have you seen that movie Jab We Met? Kareena Kapoor's cult movie, and the character which she played, Geet, became so iconic. She actually she played the role of a histrionic personality, in that movie. So everything was about herself in the movie. In this, the measles virus also is similar to that. So it first is going to think about only itself, me first, I'm going to do this. Okay, so I have to be everywhere. So measles virus, remember, a highly histrionic personality kind of a virus. It is going to leave its footprints both in the nucleus and in the cytoplasm. The other example is cytomegalovirus. Cytomegalovirus. Okay, now cytomegalovirus, it is a mega virus, so it is going to again make its presence felt both in the nucleus as well as in the cytoplasm. Okay, so these are the important examples of viruses which induce both intranuclear and intracytoplasmic inclusion bodies. Okay, now have a look at this. So this is cytomegalovirus, owl's eye inclusion body. This arrow is pointed towards an owl's eye inclusion in the nucleus of the infected cell. Is this clear? Acha, another thing I would want to tell about, because this question is on cytomegalovirus, so few pointers on it. Cytomegalovirus, only one serotype is there, and remember, it is notorious for causing infections in immunocompromised people. Like notoriously AIDS, people who unfortunately have developed the full-blown acquired immunodeficiency syndrome, that is the terminal stage of human immunodeficiency virus infection. Please remember, HIV infection is not synonymous with AIDS. AIDS is the final stage of HIV infection. So in AIDS and also in transplant recipients. Now in AIDS, okay, let me change the color of letter A in AIDS, and I would want all of you to remember ADR, a doctor. So in AIDS, what do you think I should write in front of D? Diarrhea. R is retinitis. So in AIDS, this virus causes diarrhea, that is diarrhea or CMV colitis. And in transplant recipients, remember, this is the most common, this virus is the most common pathogen in transplant recipients, and usually the infection occurs 1 to 4 months after transplant. This itself is an MCQ. And in transplant recipients, what does it cause? It is going to cause, remember, PEH, that is pneumonia. Pneumonia, esophagitis, and hepatitis. Hepatitis. Is this clear, guys? So remember, let me highlight ADR. Remember, a doctor, A for AIDS, D for diarrhea, R for retinitis. Then the other important group of immunocompromised people are the transplant recipients who are vulnerable to infection by this virus. And in them, what it is going to cause? PEH, pneumonia, esophagitis, hepatitis. All these are MCQs. Okay, all these are MCQs. Now again remember CMV, C for CMV, C for congenital malformation. CMV is an important cause of congenital, infection also, and it is known as CID or cytomegalo inclusion disease. Cytomegalo inclusion disease. Now the features of cytomegalo inclusion disease you can remember as, remember MSD. Who comes to your mind when somebody says MSD? What comes to, or who comes to your mind rather? I'm sure those of us who are not cricket fans would even answer this, would even know this. Good evening, Rashi. Very good, Med Psycho. Okay, Dhoni. So imagine Mahinder Singh Dhoni heard some poor joke or pathetic joke and started laughing, ha ha ha. So remember MSD plus P, J, and H. So M for what? Microcephaly. S for seizures. And D for deafness. D for deafness. P for what? Is the chat stuck? 1 second. Guys, am I visible and audible? MSD, remember Mahinder Singh Dhoni. Okay. P for what? Purpura. Then J for jaundice. And H for hepatosplenomegaly. Hepatosplenomegaly. Okay, now I can see. Hi, Superstar Medico. Hello, Ishwar. So remember Mahinder Singh Dhoni heard some poor joke and started laughing. Haha, these are the features of cytomegalo inclusion disease. And this purpura is going to be responsible for formation of the blueberry muffin kind of lesions. Blueberry muffin kind of skin lesions. Okay. So they're going to be because of thrombocytopenia. Is this clear? Okay, so we are on which question? We are on to question number 34. So that's about question number 34. Okay, next question, guys. Identify the organism stained by India ink stain as shown below. Okay, kind of a blurred picture. This was because see, this is all these questions are the recall questions which have been asked in the FMGE exam. So this was the picture given to me by the students. Okay, so Cryptococcus, chlamydia, Histoplasma, Aspergillus. Very, very straightforward, easy question. India ink. What is India ink? India ink is an example of a negative stain. Negative stain. What you want to see is not going to be stained, but the background is going to be stained. So that what you want to see stands out against a dark background. Okay. So the answer is straight away Cryptococcus. Cryptococcus neoformans, the most important species. Okay, so this is a summary slide to tell you the important points about Cryptococcus neoformans, which is a true yeast. True yeast meaning it is going to multiply by budding, asexual method of multiplication by budding, which is going to lead to the formation of buds or blastoconidia, also known as blastospores. These are example of asexual spores. Okay, now this is an example of a fungus which has got a polysaccharide capsule. Polysaccharide capsule, and the diagnosis is done. A very commonly used method for making a diagnosis is detecting this polysaccharide antigen by latex agglutination in serum sample, urine sample, and also one more CSF sample, of course. Okay, so remember, negative staining is done to see the capsule. Remember, negative stain, like for example, let me write it over here. Apart from India ink, what other negative stain is there? Nigrosin. Okay, nigrosin. Nigrosin. Okay, so this again is a schematic representation of the negative staining, where you can see the capsule is clearly delineated around the yeast against a dark background. Sometimes the width of the capsule can be more than the diameter of the organism itself. It can be that wide. Okay, now look at this. This organism, Cryptococcus neoformans, is the most common cause of meningitis in people with AIDS, that is acquired immunodeficiency syndrome. Okay, and the reservoirs are what? I mean, the organism is found in pigeon excreta, can cause meningitis. As I said, this is the most common cause of meningitis in HIV/AIDS. This again is a schematic representation of the negative staining. Negative staining. Acha, this also, look at this. So on culture, you can see the creamy mucoid colonies it is going to form on SDA. Now, creamy colonies are also going to be formed on SDA in case of Candida albicans. But then how will you differentiate? Of course, you will have to do other tests, but at least looks wise, the morphology of the colony will tell you something in favor of Cryptococcus, which is not going to be there in case of Candida colonies. See, let me highlight that word. The colonies are going to be mucoid in addition to being creamy white in color. Why mucoid? Because of the PS capsule, that is polysaccharide capsule. Okay, polysaccharide capsule. And look at this, black colonies are going to be obtained on bird seed agar or Niger seed agar. Rashi, Meena, it is Ames, Delhi. Okay, remember, B for black and B for bird seed, and Niger means black. Niger itself, the word itself means black. So on Niger seed agar, black colored colonies. On B for bird seed agar, B for black colored colonies. Remember, this is an example of a urease positive fungus, and all these are MCQs. It also shows Maltese cross appearance. And what is it? Maltese cross appearance, it refers to the arrangement of the capsular material of this organism as seen under polarizing microscope. Okay, arrangement of the capsular material of this organism as seen under the polarizing microscope. Any other organism comes to your mind, an important protozoan parasite which also shows multi-cross appearance? It is also seen in many conditions, but at least remember the most important ones, this one and another one which I am asking you. Excellent, Vignesh. Babesia. Babesia. Okay, is Babesia really found in India? Is it found in India? Yes or no? Babesia, by the way, is one important parasite where the definitive hosts are not humans. The definitive host is what? Hard tick. Hard tick, genus Exodus, and the intermediate host IH is humans. Okay, there are very few parasitic infections where this happens. That is, the humans, we are intermediate hosts. One is babesia. Now if I want to ask you, tell me the twin brother, or no, not twin brother, but tell me a close cousin of of babesia. Cousin as in that organism also is an intra-erythrocytic protozoan parasite. And babesia, on blood smear could be confused with that organism. Some close cousin, let's say first cousin of babesia. The common feature between the two is intra-erythrocytic protozoa, both of them are, and babesia on peripheral blood smear could be confused with that organism. Guys, acha, let me answer the previous question which I asked you. Babesia is not found in India, but the questions are asked in Indian question papers. Examiners have the habit of asking yellow fever, not found in India. Babesia, not found in India. Trypanosoma, not found in India. Okay. Excellent, Vignesh. Plasmodium. Plasmodium. Okay. If you are examining a peripheral blood smear of a patient who is suffering from babesiosis, it could be, it could mimic malarial infection, plasmodium infection, that is malaria. But there are some pointers. There are some important differences which, if you know, you can easily rule out malaria. Like for example, in malaria, malarial pigment is going to be there. In babesia, there is no malarial pigment. Okay, like that. Okay. So remember, in babesia also, definitive host, the intermediate hosts are the humans. In plasmodium, we are the intermediate host. The definitive host is, yesterday we discussed, female anopheles mosquito. And another example, toxoplasma gondii. In toxoplasma gondii also, we are accidental intermediate host. The DH or the definitive host are the cats, and the actual intermediate host are the rats. Then between rats and cats, what are we doing? We humans can be accidental. Humans can be accidental intermediate host. Now, is there anything common between these three organisms? Amongst these three organisms, B for babesia, P for plasmodium, T for toxoplasma. All these three, guys, all these three are what? They are examples of non-motile protozoa. Non-motile protozoa. In general, we protozoa are motile in general. In fact, we classify protozoa based on the organs of locomotion, like those which have got cilia, which ones have got flagella, and which ones have got pseudopodia. Okay, protozoa, most of them are motile except these three. Remember BPT. I used to remember this as, bachelor of physiotherapy, BPT. B for babesia, P for plasmodium, T for toxoplasma gondii. Is this clear, guys? Yes or no? Okay, let me proceed to the next question. Identify the egg as shown in the image. Look at this. So, what are these eggs? Trichuris trichura, Enterobius vermicularis, Ankylostoma, or Ascaris? Very good. And Enterobius vermicularis, plano-convex eggs. Okay, plano-convex eggs these are. Okay. Now look at this important picture of the important eggs of helminths. We'll go from left to right. Now look at this. Trichuris trichiura. Now look at this. Let me zoom the picture. So what you can see over here is, so this is a barrel shaped egg. Okay. So B for barrel shaped, B for bile stained. So remember, the egg is barrel shaped and bile stained. Okay. And it has got these two mucus plugs, this one and this one, at both the poles. Okay. And you can see this brownish hue of this egg. It is bile stained. Now look at this. Enterobius vermicularis has got this plano-convex egg. Acha, let me ask you, Enterobius vermicularis, what is the most, what is the telltale clinical feature of Enterobius vermicularis infection? What does the patient complain of? In enterobius vermicularis, the patient complains of what? Perianal pruritus. Perianal pruritus. Okay. Now, remember the egg is plano-convex, so like this. So, so the perianal pruritus. Now, imagine both the hips like this. So, both the hips. So, the egg, the shape of the egg is similar to shape of one hip. So, plano-convex it is. And remember, we are calling the egg as plano-convex. Plain, say, just remember plain, that is, neat and clean. So, neat and clean meaning non-bile stained. Remember it like this. And the disease caused by enterobius vermicularis is also known as what? Oxyuriasis. Oxyuriasis. Is this clear? So moving on, we are going from left to right. The third egg I have put up is Ascaris lumbricoides and the fourth one is hookworm. Let us take them together. Now they are either spherical or oval. In this diagram they both are oval. Now the eggs of Ascaris lumbricoides and hookworm, they are opposite to each other. As you can see, Ascaris lumbricoids egg has got these irregularities called as mammillations or protuberances on its surface. On the other hand, hookworm egg has got a smooth surface. Okay, smooth surface. So the rough surface is seen in case of Ascaris egg and smooth surface in case of hookworm. Okay, and Ascaris is bile stained, hookworm is non-bile stained. Hookworm is non-bile stained. Is this clear? And inside the hookworm egg, just have a look at this. Inside the hookworm, you can see the hookworm egg is going to have a segmented ovum, and each segment is known as blastomere. Okay, blastomere. Okay. Now, last but not the least, at the extreme right, you can see Diphyllobothrium latum. Such a long name, guys. Diphyllobothrium latum. Remember, this fellow is the longest. This fellow is the longest cystode or the longest tapeworm. It has got the lengthiest name to pronounce. Diphyllobothrium latum. Also known as what? Also known as fish tapeworm. Okay? Fish tapeworm. How long it is? It can be up to 15 meters. F for fish, F for 15. Remember it like that. Now, Diphyllobothrium latum, L for latum, and L for what? Lid. Lid, another name for lid or another synonym for lid is operculum. So remember, this is an example of an operculated egg. So this is the operculum. Okay, I hope you can appreciate this. This one is the operculum. Okay, and there is a knob at the opposite end, okay, and this egg has got a ciliated larva inside, and as you can see, it is brownish in color, so it is bile stained. Okay, one general rule, let me tell you, the eggs of all cystodes are bad. I mean, they are bile stained, except which one? Except Hymenopus nana, which has got non-bile stained eggs. I used to remember it as, neat and clean or saaf suthre or spick and span Nanaji. So Nanaji H Nana has got non-bile stained eggs amongst all the cystodes. Is this clear? See, parasito is so very scoring now because they can't ask anything new. All are facts. So you just have to, revise them well, make some cues, some stories, some important, diagrams, cartoons, just to help remember all these important things, and all of this you're going to find on the PW MedEd app. Launching tomorrow, guys. I hope all of you have downloaded it. Okay. Okay, can I proceed with the next question? All right. Now see this. A patient with history of travel to Ohio shows the following culture smear stained with lactophenol, cotton blue staining. What's the disease? Now, this what you can see in this picture, you can see septate hyphae, and what are these big spheres? And if you notice carefully, they have got these spine like projections on them. What are these? These are nothing but these are actually a kind of asexual spores called as macroconidia, and this morphology, this is a very specific feature of a fungus, namely Histoplasma capsulatum. Okay, what are these? These are the tuberculate. These are the tuberculate macroconidia. Okay, tuberculate macroconidia. Okay, and see, there are six important dimorphic fungi in the entire mycology, and they are very scoring questions. They're going to ask you questions on and the morphology of these dimorphic fungi. They are two-faced fungi. I personally call them two-faced fungi, meaning one, the morphology at 37 degrees Celsius, that is when they infect us, is going to be different, and the morphology when they're in the environment, that is at 25 degrees Celsius, is going to be different. And Ohio is a region in the United States where this fungus is endemic. Okay, so based on this picture, our answer is histoplasmosis and not coccidioidomycosis or cryptococcosis or blastomycosis. Now look at this, a schematic representation of the asexual spores of Histoplasma capsulatum. Okay, now is this fungus capsulated or not? Is Histoplasma capsulatum capsulated or not? Yes or no? Please answer. Please answer in the comments. Is it capsulated or not? Yes, it is not capsulated. It is not capsulated. See, microorganism names can be so deceptive, na? Okay. I used to remember this by remembering ki it's not necessary that if somebody's name is Ram, then that person is never going to do anything bad, never going to lie or cheat or steal like that. So this organism, when it was discovered, it was erroneously or falsely believed to have a capsule, but eventually it was discovered based on its analysis, the analysis of its structure, that it in fact is non-capsulated, but still they retained the name. They did not change the name. Is this clear? It is not capsulated. It's a misnomer. And this is a very famous old MCQ. Okay. So look at this. So we have got the asexual spores. See, micro and macroconidia are examples of asexual spores in mycology. Microconidia are unicellular. Okay. Because the name itself says micro, and macroconidia are multicellular spores. Multicellular spores. Okay, so A are what? A are the tuberculate macroconidia. You can see these spine like things or projections from the surface of these macroconidia, as you can see in this diagram. Is this clear? All right. Then microconidia, these the B, whatever has been marked in B, these are microconidia. Okay, these are microconidia. These are unicellular spores. Sad short videos. What is wrong? Can you point out? Now, guys, the asexual spores in mycology. Again, these are questions. Which of the following is asexual spore? Which is sexual spore? Asexual spores in mycology. Remember, A, B, C, that is arthrospores, also known as arthroconidia. Arthroconidia. B stands for blastospores or blastoconidia. C stands for chlamydospores, also known as chlamydoconidia. So remember ABC and MMS. Vignesh, all mycology appearances I'll try to cover. Okay, we have got some questions today. I'll try to cover as much as I can, but don't worry. If you want, I will take another session dedicated to it only. Okay. And anyways, you're going to find lectures tomorrow on the app also. But don't worry, if you want us to take any session, any special session, we'll take it on YouTube also. Okay, for free. Don't worry. So I have okay, let me make a note of it. Okay, I'll keep this in mind. I'll try to cover it as much as I can today. Otherwise, soon when any next session we are going to plan, I'll try to incorporate all the fungi, because frankly, it won't be possible to incorporate everything in today's session. Okay, but don't worry. Just DM me once on Instagram also. I'll make a note of it. Okay, just in case, you know, just remind me please once. Okay. Okay, then MMS. Oh, thank you so much. Means a lot. What's your name? S is okay written. Okay, so guys, microconidia, then macroconidia, and S for spores. Okay, so A, B, C, and MMS. See, I personally believe that what everybody is knows and reads, you should also read, because see, rare questions are rarely asked in exams. Okay, so these are very basic questions. And these are factual questions. Okay, we'll feel very bad when we do any factual question wrong. Okay, it's not mathematics. You have to get these questions right, and it's all about retaining stuff. Okay, so just read the relevant stuff. You don't have to keep on reading some, reading continue I mean reading too much. Just read what is relevant to what is relevant to the exam, and keep revising it. Okay, any exam for that matter, not just NEET PG, but or FMG or NICT, and any exam is just about how much you are able to retain and recall during those 3 or 4 hours of exam. It's all about that. Okay. Okay, so guys, the sexual spores in mycology. Now remember ZOAB. Z stands for zygospores. O stands for oospores. A stands for ascospores. Okay. A stands for ascospores. B stands for basidiospores. Basidiospores. So remember, Zob acts as sexual spores in mycology. Okay. Asco has got an S in it, so these are sexual spores, not to be confused with arthrospores. Okay, not to be confused with arthrospores. Okay, is this clear? One second, guys. ये क्या हो गया? 1 second. Okay, guys, just have a look at this. Screen is visible now. So who is this? Now, the names of the dimorphic fungi, remember, his pistil, shoots, bullets, and cartridges. Okay, his pistol, shoots, bullets, and cartridges. So the names of the dimorphic fungi you can easily remember like this. H stands for what? Histoplasma capsulatum. Okay. P stands for what? Penicillium. Penicillium marnefi. What is its new name? Its new name is Talaromyces. Talaromyces marnefi. S stands for Sporothrix. Sporothrix shenkai. P stands for Blastomyces. Blastomyces dermatitidis. Now C stands for Coccidioides immitis. Okay, and one more, remember, Paracoccidioides. So coccidioids word is there in two names. One is Coccidioides immitis and the other one is Paracoccidioides brasiliensis. Okay, brasiliensis. So his pistol, shoots, bullets, and cartridges. Okay, the names of the 6 medically important dimorphic fungi. Now let me ask you another question, frequently asked to me by the students. What about Canada albicans? Is Canada albicans dimorphic or not? Guys, please remember, see, thermally, when we say thermally dimorphic fungi means what are the two important relevant temperatures for us? 25 degrees Celsius and 37 degrees Celsius. 37 is human body temperature, 25 is the environmental temperature. At 25 degrees Celsius, these organisms are going to exist in the hyphae or the mold form, and at 37 degrees Celsius, they are going to exist in the yeast form. Okay, so and what is the infective form? Hyphae or the yeast? Whatever is there in the environment, that is going to infect us. Remember, these are not commensal fungi. Okay, so we acquire infection from the environment. So the hyphae or the molds or the filamentous forms are the infective form in case of thermally dimorphic fungi. Now I asked you Candida albicans, which is the most common species causing candidiasis. Remember, it is non-thermally dimorphic. Okay, it is non-thermally dimorphic, meaning to say that at 37 degrees Celsius, that is, suppose it is causing infection in somebody, at 37 degrees Celsius, we can appreciate different morphologies. Like for example, buds, that is blastoconidia or blastospores, plus it is also going to form pseudohyphae. And when it forms pseudohyphae, it is, it's not a good sign, because the presence of pseudohyphae indicates that tissue invasion is occurring by this fungus, and then it can even form true hyphae. A classical example of the true hyphae is germ tube formation. Okay, so remember, it is said to be non-thermally dimorphic. At the same temperature, it can exist in the yeast-like forms also and the hyphal forms also. Hyphae could be true hyphae or pseudohyphae. Is this clear? Please remember this. Don't falter in this. Okay, guys. Okay, guys, next question. A patient presented with fever, colicky, abdominal pain, and diarrhea. Stool sample showed structures as shown in the image. What is the likely diagnosis? So what you can see in the image? What is this? You can see a nice nucleus inside. Okay, this is the nucleus. Is it looking like E. coli? Definitely not. Is it looking like Giardia lamblia? No, we discussed Giardia lamblia. I showed you those beautiful trophozoites yesterday. We talked about the Karan Johar and Yash Chopra School of Filmmaking, where falling, I mean, they shoot their songs at exotic locations, and those falling leaf incorporate, I mean, the falling leaves incorporation in their songs, that is a very good analogy to understand the falling leaf motility. Then it is obviously not Shigella. So what is this? This is nothing but the trophozoite form of ant amoeba histolytica. Okay, ant amoeba histolytica. So this is the trophozoite form. The trophozoite form. Okay, and what is this? This, for example, this is the pseudopodia. Pseudopodia are nothing but the cell membrane extensions of these of certain protozoa like ant amoeba histolytica, which help in their motility or motion or movement. Okay, so ant amoeba histolytica, remember, it is the causative agent of what? Amoebic dysentery. Okay, amoebic dysentery. Now what is the infective form? The infective form, yesterday I told you the infective form of giardia, that is tetranucleate cyst. Here also the infective form is tetra or quadrinucleate cyst. Tetra or quadrinucleated cyst. Okay, and the trophozoites I mentioned yesterday, tropho means feeding. The trophozoites are what? Remember FIR, not first investigation report, but FIR stands for trophozoites are the feeding forms, they are the invasive forms, and they are the replicative forms. They are the replicative forms. Metpsycho, yes, yes, they are immature cysts. The immature cysts are going to have one or two nuclei. Initially, there is one nucleus. That one nucleus will divide to produce two nuclei. Then those two nuclei will also divide. And even we have got photos of trophozoites which have got three nuclei also, because the other one has not yet divided. If you see the website of CDC, Center for Disease Control and Prevention, they have all these pictures. Okay, but what I'm saying is the infective form is going to be the tetranucleate cyst, and no number of nuclei less than 4 is going to be the infective form. The number of nuclei for a cyst to cause infection in somebody has to be 4. Okay, Medpsycho? Most welcome, Medpsycho. मुझे बोलने में थोड़ा सा वो लग रहा है, Medpsycho, मतलब why this name you are chosen. It's okay. Okay, I hope the doubt is clear. Okay, guys. So causative agent of amoebic dysentery. Amoebic dysentery. Now 95% cases of infection by this organism are of intestinal amoebiasis. Intestinal amoebiasis. And in intestinal amoebiasis also, the MC site, most common site is what? Most common site is ileocecal region. Okay, ileocecal region. And the second most common site, S for second, S for sigmoid. Okay, so sigmoid colon is the second most common site, and the remaining 5% cases are of okay okay, Medpsycho, okay, understand your passion. Okay, 5% cases are of the extraintestinal amoebiasis. Okay, extraintestinal amoebiasis, also known as invasive amoebiasis. Acha, let me tell you one more thing. Some students have got this doubt that why we are calling it as invasive amoebiasis, because invasion also happens in intestinal amoebiasis, because the trophozoites are going to produce some enzymes which will create ulcers. You are very right, absolutely right. But as a convention, in all the books it is written that the invasive amoebiasis is going to be extra intestinal amoebiasis, because यहाँ पे in when we say invasive amoebiasis, we are talking about invasion of tissues and organs other than the GIT. That is the meaning of invasion, not the local invasion of the gut. Is this clear? Okay. Now next question. A 33-year-old man presented with diarrhea along with blood in the stool. On investigation of stool sample, the organism was gram negative. Okay, gram negative, non-lactose fermenter, non-motile, oxidase negative, H2S negative. What is the likely organism? Up they have given you a clinical vignette and they have given you all the clues. Imagine you are a CID agent and your job is to find the culprit, that is the tricky microorganism, and you have all the clues with you. Here comes your knowledge of basic microbiology to be applied in such clinical vignettes. That's why I was emphasizing yesterday also that if you are thorough with all these things, which is catalase positive, which is oxidase positive or negative, which is LF, which is NLF, you will have no problem in infectious diseases, whether it is FMGE exam, whether it is INICET, or it is NEET, or whether it is next. The organisms are not going to change. They will just change their way of asking questions about the organisms. So basic things are going to stay the same. You just have to practice more questions in accordance with the exam you are appearing for. Okay, so let us see. Gram negative. So what are the options? E. coli, Shigella, Salmonella. All three are gram negative. All of these are gram negative rods. What is common amongst all these three? All three belong to the family Enterobacteriaceae, which is the family of gram negative rods. Okay, so gram negative, all three are gram negative. Non-lactose fermenter. E. coli straight away ruled out because E. coli is a lactose fermenting fellow. It ferments lactose, produces pink colonies on McConkey agar. Okay, Shigella and Salmonella both are NLF. Okay, so at least we have ruled out one option. Then non-motile. Again, guys, Salmonella. The name itself has got salmon. Salmon is the name of a fish. Okay, fish should remind you that Salmonella is motile. Is motile. So again, ruled out. All right. So Shigella is non-motile. Now let us see other options. Remember, the D option is none of above. You know, as a general rule, I'm telling you, usually when they give none of above in any MCQ, it is usually not the answer. Usually. Again, it's not the rule. Oxidase negative. Is Shigella oxidase negative? Yes, it's a member of the Enterobacteriaceae family. The very definition of Enterobacteriaceae family is that it has got members who are oxidase negative, gram negative rods who are oxidase negative. H2S negative? Yes, it is H2S negative. Okay, and of course, Shigella can cause diarrhea with blood in the stool. It's the causative agent of bacillary dysentery. So our answer is what? Our answer is option B, that is Shigella. Shigella. Okay. Now remember, Shigella is a very shy kind of a fellow. Shigella. Shy, say, remember, shy fellow. Shy, very, very, shy as in, it will not do things. So it is non-lactose fermenting. It is non-motile. It will not produce, H2S. No H2S production. Is this clear? And also, it ferments glucose. It ferments glucose producing only acid and no gas. Only acid and no gas. So it is said to be what? Anaerogenic. Please do not confuse this word anaerogenic with anaerobic. Anaerobic is what? An organism which hates oxygen. Okay. What is anaerogenic? An means without, aero means air, and gen means to produce. Now, fermentation of any sugar is going to definitely produce acid and may or may not produce gas. So, gas is an optional byproduct of fermentation. So, when we say anaerogenic, we are trying to say that fermentation does not produce gas. So, this organism is anaerogenic. It ferments glucose producing only acid and no gas. Is this clear? Is this clear? Yes or no? Okay, guys, next question. Antemortem diagnosis of rabies is made with rabies virus specific antibodies, inoculation into culture media, Negri bodies in hippocampus, corneal impression smear examination for rabies antigen. They're asking antemortem diagnosis. What do you think should be the answer? Rabies virus specific antibodies. Guys, antibody detection is usually not done, for diagnosis, antemortem diagnosis. It can be done, but amongst all these options, let us just see the other options, better options. Inoculation onto culture media. This is not done. Okay. Mouse cell line is there, a cell line which can grow this virus, but viral culture per se is hardly ever done for making a routine diagnosis. Okay, Negri bodies in hippocampus, no, this is done for post-mortem diagnosis. Post-mortem diagnosis. Corneal impression smear examination for rabies antigen, yes, this is done, and it is done by direct immunofluorescence. In fact, it is considered to be the gold standard. It's highly sensitive. Okay, so the answer is option D. Option D. So antemortem diagnosis, for antemortem diagnosis, the gold standard is said to be the rabies antigen detection by DIF, direct immunofluorescence in corneal impression smear. Okay, actually most sensitive, the best specimen for this antigen detection, the best specimen is hair follicle from the nape of neck, that is the best specimen. If that is not available for some reason, even corneal impression smear can be taken. So guys, in MCQs now, you have to make a what to say, uh, you have to do a relative comparison of the options given to you. Let's say we had got one more option over here where they said, rabies antigen detection in case of hair follicle from nape of the neck, then that would have been the answer. Now amongst all these four options, if you compare, the best option is option D. As far as antibody detection is concerned, it can be done in CSF and serum, but remember, serum antibody detection is not that good, because serum antibodies are going to appear not just after infection but also after immunization, and CSF antibodies are the ones which are going to be seen only after infection and not immunization. So antibody detection is not, it is inferior than antigen detection as a method of diagnosis. Now look at this. Rabies virus. First is, this one is schematic representation. You can see beautiful surface glycoproteins called as G proteins extending from the lipid envelope. It's an enveloped virus. Now rabies, see guys, rabies is a fatal encephalitis. It is an RNA virus. Rabies virus does not come under the list of the happy viruses which I told you yesterday. So it's an RNA virus, and such a negative disease it is. It is 100% fatal. So remember, it has got the RNA genome, which is single stranded RNA. The RNA is going to be negative sense. Okay, negative sense. So negative sense single stranded RNA is the genome. Okay, now the G protein, which is antigenic, results in the formation of the neutralizing antibodies. Look at this, and this is the beautiful electron microscopic picture of the bullet shaped rabies virus. Yes Vignesh, excellent. This virus is the shape is bullet shaped virus. Okay, bullet shaped virus, as you can see in this picture. Okay, now Negri bodies, what are these? This is an RNA virus, and I told you today only, as a rule, RNA viruses usually multiply in the cytoplasm, so they produce intracytoplasmic inclusion bodies, and Negri bodies, which are the inclusion bodies produced by rabies virus, they are also intracytoplasmic. You can see a nice Negri body inclusion, intracytoplasmic inclusion body in this picture. Okay, this is an oval Negri body in a brain cell from a human rabies case. Okay, from a human rabies case. Okay, is this clear? One more MCQ I would want to tell you over here. Negri bodies they have mentioned in the third option, okay, in hippocampus. Now the MCQ which is asked over here is, what is the most common site of Negri bodies? See, Negri bodies, one second. Negri bodies are found in or present in, most common sites are hippocampus. Hippocampus, remember, this is the most common site. Okay, there has been some confusion in this option amongst the students, and they get confused between these two options, which is the better option. Better option is hippocampus. Cerebellum is the second most common site. So remember, Negri body's most common site is the hip site. Hip hop hippo. Remember it like this, hip hop hippo. So hippocampus is the most common site of Negri bodies. Okay, Negri bodies can be seen by a variety of stains. Okay, one of the good stains is Seller's stain. Okay, and even better will be immunohistochemistry. Immunohistochemistry. Okay guys, chalo, next question. Bacillus anthracis is gram positive coccus. Is a gram positive coccus in clusters? Gram positive rod with squared ends, gram positive bacillus with club shaped ends, gram negative coccus in pairs. What is this now? Tell me. What is the answer? Gram positive coccus in clusters. Gram positive meaning positively blue color, grape like clusters. Okay, imagine this is a grape like cluster. This is classical definition of which organism? Genus Staphylococcus. Genus Staphylococcus. Okay, so this is wrong. Gram positive rod with square ends. something like this, gram positive rod with square ends, nice, bacillus like this is what is bacillus anthracis, by the way? Bacillus genus bacillus is what? Gram positive only. Okay, so this can be the answer, but I would want to also tell you that don't be in a rush to mark the option A or B. If you feel it's the right answer, please have patience to read all the four options. You might be surprised by the C and D options, they might be a better answer. Okay, so the third option, gram positive bacillus with club shaped ends. Club shaped meaning something like this. Have I mentioned this? Have I discussed this yesterday? Club shaped ends. Any organism you can tell me whose name, the first six letters in the name of that bacterium, one of my favorite bacterium and favorite of examiners also, has got six letters, the meaning of which is club shaped. I explained it yesterday. I showed you one picture also, and I told you also that I've been to that country for teaching, and I was surprised how, I mean, according to me, there is no resemblance between the letters, the language of that country, and the arrangement of that organism mentioned in the books. Gram positive bacillus with club shaped ends. What organism it is? What is this? What should I write? Guys, it is Corynebacterium. Corynebacterium. The first six letters, one, two, three, four, five, six. Corony means what? Club shaped. Corony means club shaped. Yes, absolutely right, Vignesh and S. Okay. ये भी गलत. So this also is wrong. Gram negative coccus in pairs. That is gram negative diplococci. This also is wrong. What is the example? Neisseria. Neisseria. Remember, all cocci are not spherical. We have got gram negative cocci like Neisseria. We have got meningococcus, which is plano-convex like this, which is encapsulated, and we have got gonococcus. Remember, how do we write gonococcus? G-O-N-O, gonococcus. Now let me highlight the letter G. Okay, and this G looks very similar to this kidney or bean shaped kind of this diagram, isn't it? So gonococcus is what? Gonococcus is kidney shaped or bean shaped. Okay. Yes, Vignesh, absolutely right. Uniform arrangement. I said na yesterday that Chinese letters. I saw the hoardings in China, but according to me, have got hardly any resemblance. Anyways, my personal opinion. Okay, so what we are left with? Gram positive rod with square ends. Yes, genus Bacillus definition is that it is a genus of gram positive rods or gram positive bacilli with square ends, as I have drawn over here schematically. Bacillus anthracis, remember, this is the largest bacterium, largest B for bacterium in the entire, bacteriology, clinical bacteriology. And being the largest bacterium, it has got also a big ego, a big ego. So it is not going to move around. It will just sit nicely in its place and it will not do a lot of things. Okay. So I used to remember it when I was a student, as such an egoistic organism which is biggest in size, it will not move. So it, remember, it is non-motile. And why I used to think of all of this, because these were MCQs, and they still are MCQs. When I was preparing for exams as a student, all these were MCQs. So I should I used to remember stuff like this, which I'm sharing with you. Okay. In fact, this organism is one of my, again, favorites. I have put up a special Instagram post, busting the ego, not exactly busting, but figuring out what all things it does not do because of its big size. You can check that out. Okay, that's on my Instagram handle. Yes, it is non-motile. It is non-motile. Acha, now have a look at this. Okay, they said option B is what? Which is our answer? Gram positive rod with square ends. Now have a look at this. This is the actual picture. So a photomicrograph of Bacillus anthracis bacteria using gram stain technique. Look at this. They are arranged in chains like this. Is this clear? Is this clear? Acha, 1 second, guys. 1 second. Okay, few pictures I would want to show you. Now have a look at this. Acha. You saw the picture of what is that? The square, the nice bacilli with squared ends, and usko kya what do we call it, that this kind of morphology of bacillus anthracis is described as boxcar appearance. ठीक है, boxcar appearance. Now let me show you one more picture. Look at this. So this is bacillus anthracis gram stain, and these are the organisms which have got spores. So look at this. The cells have got characteristic squared ends. The endospores are ellipsoidal in shape and located centrally in the bacilli. Now look at this. Now guys, in the entire, okay, one memorizing tip I will give you. I have mentioned that in my videos also on the PW MedEd app launching tomorrow. Okay, excited. Now look at this. Spores as a rule. As a rule, remember, spores are not produced. They are not produced by gram negative B for bacteria as a rule. So if I ask you, Escherichia coli is spore producer or not, answer is no, because it's gram negative. What about Shigella? What about Salmonella? What about Vibrio cholerae? What about Haemophilus? All of them are gram negative bacteria. They do not produce spores. Okay, they don't produce spores at all. So, and the spore producing genera in the entire bacteriology are only two important ones you have to remember, that is BC. Okay, before COVID or before Christ, whatever way you want to remember it, but out of one of these two ways you should remember it by. B for what? B for bacillus and C for clostridium. Okay. Now, spores are going to survive for decades and decades together in the environment. So, another memorizing tip I would want to give you is that, okay, let me just zoom out. Where do I write? Okay, I'll write it over here. Remember, spores, one sec. Remember guys, spores survive since BC, before Christ. यहाँ पे the meaning of BC is before Christ. So as I said, spores are going to survive for decades and decades together. Spores survive since BC. So BC means Bacillus and Clostridium. And keeping in mind the rule that spores are not produced by gram-negative bacteria, by default, genus Bacillus and Clostridium are what? They are gram-positive. What is their shape? They are gram-positive rods, also known as gram-positive bacilli. Okay, one more thing, let me clarify over here. Bacillus, when we say, it is the name of a genus also, like, this genus Bacillus has got so many species: Bacillus anthracis, Bacillus cereus, okay, and other species also, like Bacillus stearothermophilus, whose new name is now Geobacillus stearothermophilus. All right, Bacillus subtilis, like that. Plus, another meaning of the word bacillus is the shape of bacteria. Okay, so keep both these things in mind. So in this picture you can see the spores, and what these spores, how do these spores look like? They are, how are they described? They are non-bulging spores. That is, the width of the spore is same as the width of the bacillary body. So genus Bacillus has got what? Genus Bacillus has got non-bulging spores. Okay. Okay. Now look at this. I hated every minute of training, but I said don't quit, suffer now, and live the rest of your life as a champion. This is not the last slide of this class where I am trying to give you some pep talk. Of course, you should remember this timeless saying by Sir Muhammad Ali. And the reason why I put up this picture is to tell you that Clostridium genus, let me write CLOS, Clostridium. Okay, Clostridium. The word clos should remind you of closed. So look at this. The closed fist of Sir Muhammad Ali, it is going to lead to what? What are these? Bulging biceps. Okay, bulging biceps. So remember, in genus Clostridium, the spores are going to be bulging spores. The spores are going to be wider than the bacillary body, whereas genus Bacillus has got non-bulging spores. Okay. So a little bit of pep talk also, along with some microbiology. Is this clear? Clostridium, closed. Closed also serves as a reminder of the fact that these organisms, genus Clostridium, is anaerobic. Whereas genus Bacillus, they are either aerobes or facultative anaerobes. Is this clear, guys? Yes or no? Please comment in the chat box and let me know. Okay, let me show you some photo, one photo, good photo of this these bulging spores. Like Clostridium tetani has got the spores which are, terminal and spherical, which are described as drumstick appearance. Look at this. Look at this, nice. This one. Okay. Is this clear? Okay, so that's about that question. Acha, one more thing. 1 second. We were discussing bacillus and anthracis, right? One more thing. Few appearances. Okay, what is this? The actual picture of frosted glass, okay? And the colonies of bacillus and anthracis are also referred to as having frosted glass appearance. And what is this? This is blood agar. Can you see any hemolysis? No hemolysis. So remember, bacillus anthracis. Bacillus anthracis is non-hemolytic. Again, guys, it's an egoistic fellow. It's the biggest bacterium. Why should it do any work? Why should it be motile? Why should it cause hemolysis? So it is non-hemolytic. Non-hemolytic. Is this clear? Okay, chalo, next picture. Now what is this? Okay, the actual picture of Medusa marble sculpture by Gian Lorenzo Bernini in the Capitoline Museums. What a tongue twisting name, Rome. Okay, you must have if you even if you have, if you don't know this story, Medusa head, just spend a few minutes on Wikipedia. It's an interesting story. It will just take 10 minutes of your time, but very interesting. Read it. You will be able to remember micro also better. Now see this. Now, Medusa head appearance, the snakes you saw on the head. Now the colony morphology of Bacillus anthracis at the edges, if you see under the microscope, it has got these this snake like appearance described as Medusa head appearance. See, this is the microscopic picture. Can you see? And compare this with this Medusa head appearance, which is appreciated when you examine the edges of the colony. Look at this. I have zoomed in the edges of the colonies. You can see some kind of granularity, uneven sea appearance. If you examine this edge under the microscope, you will see this, which is described as Medusa head appearance. Yes, right, Vignesh. Acha. Medusa head appearance. Okay. So look at that. And in books, the colonies have been described as locks of matted hair. This is how matted hair looks like, na? Matted hair. Essay. Okay. Another picture of the same thing. Okay, one more thing. Look at this inverted fir tree appearance on gelatin liquefaction of Bacillus anthracis. Why? Because it is what? It is a facultative. It is a facultative anaerobe. So the liquefaction is going to start at the top and it will gradually diminish at the bottom, giving rise to the inverted fir tree appearance. Okay, inverted fir tree appearance. Is this clear? All right, next question. Neisseria meningitidis infection can be due to deficiency of C1, C4, C5, C9, C3, C2. What are these C's? These C's are what? What are these? All these are complement proteins. Okay, they are complement proteins. Complement. Have I written the correct spelling of the complement? Is this right or is this right? What I'm going to write abhi. Complement with an E is correct or complement with an I? The complement system which we read in immunology. Tell me which is correct. Complement with an I or complement with an E? Yes, complement with an E and not complement with an I. Compliment with an I means what? Means to praise someone. Like, I would want to genuinely praise all of you for giving your time to this session, and trying to learn things along with me. I appreciate you devoting your time to this session, because everybody's time is important. Okay. Now, compliment with an E means what? Compliment with an E means to help someone. To help someone. So we have got some important proteins of the innate immunity which are going to help us in the acquired immune response, that is AIR, and also in inflammation. Okay. So these complement proteins, they are like, sleeping proteins, or because they are pro enzymes or inactive enzymes or zymogens as they are called, and they are going to wake up from sleep only when some infection happens. All right. And there are three kinds of alarm clocks who are going to wake them up and call them for help. C for classical pathway, A for alternate pathway, L for lectin pathway. Okay. So in different scenarios, they are going to be these complement proteins are going to be awakened from sleep. Just like, when suppose tomorrow we have got exam and we are in the hostel, we tell our mom also ki subah utha dena, wake me up early in the morning. Then we tell our friend also to wake us up, and of course we are going to set an alarm in our phone also. Okay. So many kinds of alarms, because we are so worked up or stressed about tomorrow's exam. So similar to that, I think this analogy is pretty good to understand how complement proteins are going to be activated, and all of this in detail I've discussed on the app. Okay, now coming back to the question, Neisseria meningitis infection can be due to deficiency of the late complement proteins, that is C5 to C9. Okay, C5 to C9. Is this clear? Most welcome, YouTuber. Not just Neisseria meningitis, but also you can write, and even gonococcus, the second important medically significant species, that is Neisseria gonorrhea infection, is also going to be common in people who are deficient in the late complement proteins. Late complement proteins. The reason is the late complement proteins, they help in what? They help in MAC formation, that is membrane attack complex. Whose membrane is going to be attacked? The microorganism's membrane. What membrane can it be? It can be the outer membrane if it is a gram negative organism, because that is the outermost, or it could be the cell membrane, because in gram positives who do not have the outer membrane. Is this clear? Acha, one more thing I am tempted to talk about over here is, immunology, by the way, is one of, in the entire micro, I absolutely love immunology. I have a soft corner for it, and it is very, very interesting. You get to see a fantastic teamwork, guys, of how our immune system members are going to come to our rescue when we need their help, when we need their support. So I believe we are never ever alone. We have got millions of microorganisms on us, inside us as commensals, and also we have got a fantastic teamwork in the form of the beautiful immune system. Afsal, PDF will be uploaded on the MedEd app. Yesterday I mentioned that it will be uploaded on the Telegram channel, but after the session I got to know from the team that they're going to upload it on the PW MedEd app, the link of which is given in the description. Okay? So don't worry, I have shared the PDF with them, and it will be uploaded shortly. Okay? So don't worry, today and yesterday's PDF you will find on the app only. Okay? Acha, one more, as I said, I was tempted to tell you one more thing. See, guys, irrespective of the alarm clock, that is CAL, classical pathway or alternate pathway or lectin pathway, the end result is going to be the formation of membrane attack complex, which is going to be an amalgamation or a union of cylindrical proteins like this. You have got C5b protein, then it is going to conspire with other complement proteins, like you have got the C6 protein, and you have got C7 protein, and you are going to have the C8 protein like this, and multiple molecules of C9. Okay, 1 2 3 4 5 6 7 8 9, like for this, all these green things which I am drawing. MedPsycho is annotated ही दिया है मैंने, ठीक है, don't worry. ठीक है, PDF is annotated. This after this session also you will get annotated PDF. Okay. So you can just review the video once again and quickly see what I mean. You can add points to the PDF. Okay, because whatever I'm saying and not writing, that is not going to be there in the PDF, but the important things, all important stuff, I'm writing only. Okay na? Okay, most welcome, med psycho. So all these green cylinders are what they are, C9. So this membrane is going to, I mean, this membrane attack complex. So this is a complex of what, of proteins. Of how are these protein, how do these proteins look like? They are cylindrical proteins. They are going to insert themselves in the membrane of the of the bacterium. Now look at this. Now gram positive bacteria are what? The gram positive bacteria are positively blue. Okay, now gram negative bacteria are going to appear red. Remember, red is the color of what? Shed or khun kharaba, or something negative. All right, now a common thing, of course, in all living organisms, like in us also, the innermost part, the innermost layer surrounding the cytoplasm is the cell membrane. Now in gram positive, remember, positive means more, so the peptidoglycan layer of the cell wall is, it's going to be very very thick. Let me draw it in these spiral orange circles. So gram positive mein what is, gram positive have got a very thick PG layer, peptidoglycan layer it is. In gram negative, on the other hand, you are going to have an additional membrane which is known as the outer membrane. So this yellow outline is the outer membrane. Okay, outer membrane, and this space between the cell membrane, the red one, and the outer membrane is known as the periplasmic space. Imagine this periplasmic space is a kind of locker. If we are calling it space, so it should accommodate something. And what is that something? That something is a single layer of peptidoglycan, cell wall. Peptidoglycan layer, single layer is there. Now you have seen this complex, such a gigantic complex it is, and its name is membrane attack complex. It is going to attack the membrane. Now guys, in case of gram positives, there is such a thick layer of peptidoglycan, and in some cases it can be 100 times thicker. The peptidoglycan layer in G positive organisms can be 100 times thicker than the PG layer, peptidoglycan layer of gram negatives. So it's a little bit tedious or difficult for this gigantic complex called as membrane attack complex to traverse through this thick layer of PG to reach the cell membrane. But it doesn't mean that it cannot kill gram positive bacteria. Of course, membrane attack complex is going to be working against gram positives also, but in life everything is relative. Okay, everything, I mean, most of the things in life are relative only. So over here we are trying to learn that in contrast to gram positive organisms, it is easier for the complement system to attack gram negative organisms, because gram negatives are very very vulnerable. They have got this outer membrane which can be attacked by the membrane attack complex. And what is going to happen after this attack? There is going to be a hole insertion in the outer membrane. Outer membrane is nothing but also phospholipid bilayer with some additional proteins called as porins. P for porins, P for proteins. Another MCQ. Porins are found in which organisms? Gram positive bacteria, gram negative bacteria. Answer is gram negative bacteria. Okay. So can any organism live when holes are being inserted or drilled into any of its structural component? No, it is going to die. Okay, so it doesn't matter for membrane attack complex what kind of membrane it is going to meet. It has to be a membrane. It is easily going to find a membrane in case of gram negatives, because outer membrane is the outermost structure. Okay, of course some organisms may have the capsule, but that is okay. Capsule is going to be taken care of. They can the membrane attack complex can insert itself through the capsule. Okay, but in gram positives it is going to take some time, some effort is going to be taken to traverse through the thick PG layer to reach the cell membrane and start digging holes. Is this clear? And Neisseria, which we are talking about, they are what? They are gram negative organisms. And so in general, if late deficiency of late complement proteins is there, it will be, the gram negative infections should be more common. And yes, they are more common, and it's just an observation that amongst all the gram negative organisms, Neisseria infections are more common in people with deficiency of the late complement proteins. Be it, I mean, it can be either gonococcus or meningococcus. Is this clear? Yes or no? Please respond by saying yes or no. Okay, great. Med Psycho and Vignesh. I hope for others also it is okay, understandable. Shall I proceed? Okay. Now, next question. A patient presented with some unknown fungal infection. Microscopic examination revealed brown colored spherical bodies with internal septations. What's the possible diagnosis? Histoplasmosis. Sorry, it is histoplasmosis, chromoblastomycosis, coccidioidomycosis, or candidiasis. What I've what I have highlighted in yellow is the clincher. Which of these infections is characterized by brown colored spherical bodies with internal septations, guys? Very good. Chromoblastomycosis, not histoplasmosis. This we have covered today only. Neither, not also coccidioidomycosis or sorry, what is this? Yeah, candidiasis. Chromoblastomycosis. Okay, now look at this. So the brown colored spherical bodies with internal septations are these. Okay, the same picture has been asked in both NEET PG and INICET also. What are these? These are known as, okay, C for chromo. Chromo means color. Okay, remember these are, so these spherical bodies, remember copper penny, so they are also known as copper penny cells. Copper penny cells. Yes, very good, Vignesh. Medlar bodies. Any other name? Medlar bodies, also known as muriform cells, also known as sclerotic bodies. Sclerotic bodies. Okay. So we have got, remember them as M2SC. M for medlar, M for also muriform, S for sclerotic, and C for copper penny bodies. Okay, copper penny bodies. See this, guys? Okay, chromoblastomycosis. Okay, let me dissect the name of this condition. Chromo means what? Chromo means color. Blasto. I want you all to remember that blasto in this word chromoblastomycosis designates something blasting out of the skin. Some, some elevated skin lesion. Chromoblastomycosis, remember, it's an example of a subcutaneous fungal infection or subcutaneous mycosis. Okay, subcutaneous mycosis or subcutaneous fungal infection. Okay. हाँ, yes, med psycho, you're absolutely right. This is their favorite. ठीक है, इसलिए I thought I'll devote some time on this. ठीक है ना? So chromoblastomycosis. So chromo means color. Okay. Color meaning, remember, the causative the fungi of this condition, chromoblastomycosis, they have got black or brown hyphae. Color does not mean the Vibgyor color, not red, blue, pink, light pink, dark pink, pink, magenta, not all of that. But those fungi which have got, demataceous hyphae, that is, they have got black or brown hyphae. Such fungi are known as demataceous fungi having black or brown hyphae. So, there are different kinds of morphologies of the skin lesions seen in this condition, chromoblastomycosis, and the most common morphology is verrucous lesion. Verrucous means having a rough or uneven surface, remember. So verrucous lesions blasting onto the skin, as you can see in this picture. And see, look at this. This is a picture of the lower limb. Remember, these fungi are not commensal fungi. They are present in the environment as saprophytes, and the mode of infection is traumatic inoculation. And so when, trauma occurs, it is, more commonly going to affect the lower limbs, LL, than the upper limbs. So remember, lower limbs are more commonly affected than the upper limbs. Now, the mode of infection is traumatic inoculation, and the fungi are there in the environment. See, in general, who stays outside the house for a longer period of time, males or females? This is just a little memorizing tip, guys. I mean, not in the today's context. But just remember, like in olden days, the females used to be confined to the home and the males used to go out to earn a livelihood for everyone in the family. So just remember, males are more likely to be outside the house, so more likely to trauma, and trauma is more likely to occur in the lower limb. That is, lower limb is going to be inflicted more commonly than the upper limb. So just remember, males are more commonly affected than females. Okay, this is how you should try to remember things. This picture next I already have explained, the copper penny cell. So remember, the varicose lesions, their surface resembles like what? Cauliflower, isn't it? So that is why I thought, okay, let me draw a cauliflower over. Okay. So this is a schematic representation of these brownish cells with vertical and horizontal striations or internal septations. Okay. Is this clear? So that's chromoblastomycosis for you. Now, some of the important, fungi, the chromoblastomycosis is caused by, okay, few important names you should know. Don't be petrified of the names. Remember, it's going to be an MCQ exam, and I always tell the students, it's an MCQ exam. The answer is in front of you. One of the four options is the answer. There is no viva voce. Nobody is going to ask you anything. So don't worry about the lengthy names or the spellings. Just read your notes, 3-4 times, and it will come back to you, during while attempting the questions. Okay. So remember, Fonsesia. Thank you so much, Vignesh. Drawing has been a hobby since school. I thought, let me incorporate into micro also. Okay. Okay, so the causes are Fonsesia pederosoe. Okay, then Fonsesia compacta. Then Fialophora verrucosa, Cladosporium caryonae, and Rhinocladiella aqua sparsa. So 1, 2, 3, 4, 5. 3, 4, 5, remember, just remember them as PCR. First is Fonsesia pedrosa is most common, so that's why I wrote it at the top. Okay. So just remember, let me encircle this. F for Fonsesia, P for pedrosa, C for compacta. So F for Fonsesia, the name of the genus, remember PC, Priyanka Chopra or personal computer, whatever you like. P for pedrosa, C for compacta, and then we have got PCR. Okay. So little petrifying names, I agree, but as I said, it's going to be an MCQ exam. You just have to mark the answer. Is this clear? Okay. Next question, guys. The classical pathway of complement is activated by. A few minutes back, I told you that the sleeping complement proteins. So these are the sleeping complement proteins. They are, who is their alarm clock when they are going to be. They are going to wake up, and they are going to, they are going to come to our rescue to help us whenever an infection occurs. So this alarm clock can be C, A, and L. That is the classical pathway. The alternate pathway, also known as the alternative pathway, and the third one is the lectin pathway. Now the classical pathway is going to be activated by antigen antibody complex. Okay, answer is option D, not C1, not C1 or C3 convertase or IgA. Okay, alternate pathway, A for alternate, A for activators, A for activators. Now, who are these activators? Now, for example, LPS, lipopolysaccharide of gram-negative bacteria. Gram-negative bacteria have got lipopolysaccharide, number 1. Okay, number 2. Teichoic acid. Teichoic acid is present where? Teichoic acid of gram-positive bacteria. Number 3, so we are taking, example, some components of bacteria as the activators. Then in fungi also, chitin. What is chitin? Chitin of the fungal cell wall. Chitin of the fungal cell wall. Fungal cell wall. What is chitin? Another MCQ. Chitin is what? Okay, I would really like to spend 1 minute of chitin over here. What is chitin? Can anyone answer? What is chitin? Okay, guys. Chitin is, what is this? Okay, chitin is nothing but a homopolymer of N-acetyl glucosamine. Okay, so chitin is a homopolymer of NAGA, that is N-acetyl glucosamine. Have you heard NAGA anywhere else also? Chitin is there in the fungal cell wall. NAGA is also present. It is also present in the bacterial cell wall. Okay, bacterial cell wall. Bacterial cell wall is peptidoglycan. P for peptido means protein, and glycan means the sugar part or the saccharide part, which has got alternating units of NAGA, NAMA, NAGA, NAMA. NAGA is N-acetyl glucosamine. NAMA is N-acetyl muramic acid. NAMA is exclusive. So NAGA is there in both bacterial cell wall and fungal cell wall, but NAMA is exclusive to the bacterial cell wall only. So bacterial cell wall is also known as what? It is also known as mucopeptide or murine cell wall, or muramic acid cell wall. Is this clear? So the third activator. Number 4, guys, certain antibody molecules, like for example IgA. A for IgA, A for alternate. Then we have got IgD, and we have got IgG4, and then C reactive protein, and also snake venoms. Snake venom. We can easily with Nagin. Didn't understand. So these are some of the important activators. When any of these activators is there in the body, alternate pathway will be activated. Okay, then lectin pathway is activated by what is known as mannose, our protein called as MBL, that is mannose binding lectin. Mannose binding lectin. Okay, okay, med psycho. Okay, understood. Mannose binding lectin. Mannose binding lectin is a protein being synthesized by our liver cells, and this is a lectin protein which is going to bind to mannose. Mannose is the sugar which is present on many microbes. So if any infection occurs with any organism decorated with mannose on its surface, then lectin pathway is going to be activated. Okay, so lectin pathway can be activated right after infection, isn't it? Similarly, alternate pathway can also be activated by any of these activators, because let's say somebody gets infected with gram negative organism, gram negative bacterium, LPS can straight away go and activate the alternate pathway. So both alternate and lectin pathways can be activated immediately after the infection, but classical pathway, which is activated by the antigen antibody complex, is not going to be activated right away, because antibody formation is going to take some time. It is going to take a few days, and once the antibodies form after a few days, they have to go bind to the antigen to form a complex. So classical pathway is going to be activated not immediately after the infection, but several days after the infection. Is this clear? All right. Okay, next question. The DNA transfer in bacteria via phage is known as conjugation, transduction, transformation, or translation. What is this? Yes, it is transduction. DNA transfer in bacteria by the agency of phages is known as transduction. Okay. Now, conjugation is what? Conjugation occurs with the help of what? A bridge forms between the two cells. Remember, C for conjugation, C for contact. C for contact. If this is one bacterium, there's a conjugation tube formed between this bacterium and the other bacterium. Okay. So this is referred to as the sex pilus. Okay. This is bacteria A, bacteria B. All right. And conjugation is mediated by plasmid. This is what? This orange circle is plasmid. What is plasmid? Plasmid is extra chromosomal genetic material seen in certain bacteria, not all the bacteria. Okay. Transformation is what? Transformation is uptake of DNA. Uptake of DNA or genes from dead bacteria into the live bacteria, and so the life of this live bacterium is going to change now. Transformation was first discovered in case of pneumococcus. Okay, by Griffith. Translation is nothing but protein synthesis. It's clear? Okay, next question. Hemolytic uremic syndrome is associated with Escherichia coli O157H7, malaria, parvovirus B19, or Bartonella henselae. This I discussed yesterday. Do you remember what we learnt about hemolytic uremic syndrome? I told you HUS, hemolytic uremic, the EHEC. Highlight H, and I told you 3 H's yesterday. Hemorrhagic colitis, hemolytic uremic syndrome, and hamburger, the beef hamburger. Okay, so hemolytic uremic syndrome is associated with, as we discussed yesterday, Escherichia coli O157H7. Okay, not with any of the other options. Now HUS, hemolytic uremic syndrome, is characterized by the triad of, remember, MTR. Now MTR is a famous brand of ready to eat meals, and HUS in Hindi, it means hasna. It means to laugh in Hindi. So just remember, have a good time, laugh and eat good food. A good food meaning MTR packets. M stands for what? M stands for microangiopathic hemolytic anemia. M stands for microangiopathic hemolytic anemia. T stands for thrombocytopenia, and R stands for renal failure. Okay, R stands for renal failure. So remember, enjoy MTR packets, watching some good comedy series on Amazon, like the recent one was by Anubhav Singh Bassi. I really liked it personally. Okay, just a little memorizing tip, guys. The features of HUS, hemolytic uremic syndrome. Is clear? One more thing I would want to tell you over here. See, EHEC causes what? It causes bloody diarrhea. Now there was an MCQ where the patient presented with bloody diarrhea, and in the option there was EHEC and there was also Shigella, but the patient did not have fever. Okay, so how to choose between Shigella and EHEC? The other two options were easily ruled out. Okay, so bloody diarrhea caused by EHEC, that is hemorrhagic colitis. Remember, there is no fever. Patient does not have fever in this condition. Please remember this. Okay, then next question. Subacute sclerosing panencephalitis is a rare and dangerous complication of measles, mumps, rubella, varicella. It's a rare and dangerous complication of, easy question, straightforward question, factual question, measles virus. Remember, I told you yesterday the names of the paramyxoviruses. Para means big, mixo means affinity for mucin glycoproteins which are present as which are the receptors present on the respiratory epithelial cells and the RBCs of certain species. So paramyxoviruses. Okay, remember, para means big means big prices these days. Big prices meaning, recall, M2RP, maximum retail price. Measles, mumps viruses, respiratory syncytial virus, and parainfluenza virus. Okay, now measles has got just one serotype. One attack is going to give lifelong immunity. Incubation period is 10 to 14 days, after which the patient is going to have a measles prodrome. The measles prodrome of fever plus cough, fever plus cough plus coryza plus conjunctivitis, and conjunctivitis is going to lead to photophobia. So remember, fever plus the three C's and photophobia. After this prodrome, the patient is going to the patient is going to have a rash. The rash is typically maculopapular, okay, and it starts behind the ears. It starts behind the ears, okay. Then it spreads from top to bottom, head to toe, top to bottom, and it disappears in the same order. It disappears in the same order, but 1 or 2 days before the onset of rash. See, the incubation period I said is 10 to 14 days now. So it is, just remember, 10, 12, 14. Okay. Now from 10 day, the prodrome will occur. Let's say, the incubation period is 10 days. On 10th day, prodrome starts. Then on 12th day, Koplik spots will appear on the buccal mucosa opposite the lower central, over the opposite the lower molars. So Koplik spots appear, and on day 14, rash. So it is described that Koplik spots are going to appear 1 or 2 days before the onset of the rash, and the rash is going to appear in the same order. That is, the rash appeared from top to bottom, and it will also disappear from top to bottom. Is this clear? What did I say about measles today? Look at the name measles. I have highlighted something ME. Have I mentioned anything about measles? Some important MCQ. Measles has got ME in its name. It is going to, it's very egoistic or histrionic. So it is going to induce the form, very good Vignesh, both intra and extra, both intranuclear and intracytoplasmic inclusion bodies. Yes, S, absolutely right. The measles rash is going to not involve palms and soles, right? Now, next question. Identify the parasite whose egg is shown in the image. Fasciola hepatica, Schistosoma japonicum, Schistosoma mansoni, or Schistosoma hematobium. What kind of egg is it? I mean, to which of these organisms does this egg belong? Now have a look at this. I've put up a picture, eggs of schistosomes. It is not Fasciola hepatica at all, okay? So important, the eggs of schistosomes are very, very important. So we have got the three important pathogenic species of schistosomes are what? Blood flukes. They are nothing but the blood flukes. So the important species we have are Schistosoma mansoni. Look at this. Mansoni egg has got a lateral spine. And look at this. I have put up a picture of this man lying on the bed. So remember, mansoni. I've highlighted man, man of mansoni, and L of lying on the bed. So man comfortably, resting on the bed. Mansoni ka egg has got lateral spine. Then the middle one, Schistosoma hematobium. The egg has got terminal or posterior spine, and Schistosoma japonicum's egg has got no spine or a rudimentary spine Now Schistosoma hematobium, guys, it's an important, it causes what? It causes painless hematuria, okay, and also it is a causative agent of squamous cell okay, yes, okay, that's also a good way to remember. Squamous cell carcinoma, okay, of the urinary bladder. Now as far as cancers of urinary bladder are concerned, remember, obviously we all know that transitional cell carcinoma is way more common cancer of urinary bladder as compared to squamous cell carcinoma, and this organism is an important cause of squamous cell carcinoma of urinary bladder, okay. So S for schistosome, which one? Hematobium. S for squamous cell carcinoma of the urinary bladder, okay. And remember, in case of these blood flukes, definitive host is man, and intermediate host is the snail. In case of in fact, in all the flukes, in case of all the flukes, the definitive host is man and intermediate host is snail. Today I told you three important parasitic infections where man is the intermediate host. Who is, I mean, so what is, which are those important parasites? Can you recall? Can you recall, guys? I told you BPT, Bachelor of Physiotherapy, B for Babesia, P for Plasmodium, and T for Toxoplasma gondii. है ना? In these three parasites, man or the human beings are the intermediate host. Okay. Okay. Next question. Yes, very good, Vignesh. A patient presents with the following findings. What will be the media used to diagnose this condition? So what is this? Okay, look at the finding. What you can see? What is this? What is the diagnosis? Most likely diagnosis, looking at this picture. Very good. Diphtheria. You can see clearly a membrane in the throat. Okay, so what is the best, what will be the media used to diagnose this condition? Meaning, what media you expect to allow the growth of Corynebacterium diphtheriae? Is it low floor serum slope or Lowenstein Jensen medium? Sorry, it is Jensen medium, Carrie Blair medium, or chocolate agar? Answer is not LJ medium, not Carrie Blair, neither chocolate agar, Loeffler serum slope, that is LSS. The name itself has got serum in it, so it is an enriched medium. It is an enriched medium. And remember, Corynebacterium diphtheriae is what? Corynebacterium diphtheriae is a fussy fellow, fastidious fellow. I explained this terminology yesterday, why I call these organisms as fussy or fastidious. Okay, so Loeffler serum slope is an enriched medium, and it is good for inducing granules. It is good for inducing granules. Okay, now look at this. The best medium for growth of Corynebacterium diphtheriae is potassium telluride blood agar. This is the best medium, and on this medium black colored colonies are formed, as you can see in this picture. Okay, black colored colonies are formed. All right, so potassium telluride blood agar is what? It is an example of a selective medium and differential medium. Selective media are those media which show partiality or favoritism, or partiality or favoritism or affinity or love for only certain microorganisms and not others. So if you're suspecting Corynebacterium diphtheria infection in someone, let's say someone comes with upper respiratory tract symptoms with bull's neck appearance, you're suspecting diphtheria, you collect a throat swab. So obviously some commensals are going to be there in the throat swab. Are we interested in growing commensals? We are not. So better to you, and based on the disease, the infection we are suspecting, go for that selective medium. Like for example, in such a scenario, if you are suspecting diphtheria, if you have potassium telluride blood agar, great. So you inoculate the throat swab on this medium so that commensals will not grow. This organism, if it is present in the sample, is going to grow. So it's a selective medium. Why it's a differential medium? It is going to help us differentiate it is going to help us differentiate this organism, that is the pathogen, from the other organisms. Let's say, even if some commensals are able to grow also, but Corynebacterium diphtheriae, when it grows on this medium, it is going to reduce the potassium telluride in this medium to metallic potassium, sorry, to metallic tellurium, and this metallic tellurium is going to be incorporated in the colonies, giving them a black color. Okay, giving them a black color like this. Is this clear? So this is the best medium. Is this clear? Okay guys, next, a bacterium which can sustain more than 100 degrees Celsius is classified as thermophilic, mesophilic, psychrophilic, halophilic. जो differential S, okay, differential media are usually those media which have got some indicator into them, like for example in for example in this one, potassium telluride blood agar, okay, KTBA, potassium telluride blood agar के केस में ना, we have got potassium telluride. Now potassium telluride, it is going to be reduced to metallic tellurium, and this metallic tellurium then enters the colonies and imparts them a black color. So even if some other organism has grown, that will not have black colored colonies. So we will be able to differentiate this organism, the pathogen, from that organism which might grow. Is this clear? S? Okay, next question. A bacterium which can sustain more than 100 degrees Celsius is classified as thermophilic, mesophilic, psychrophilic, halophilic. It is thermophilic. Mesophilics are what? Which are grow at 20 to 40 degrees Celsius. Thermophiles by definition are the ones which grow at more than, actual definition is more than 50 to 60 degrees Celsius. So the answer is thermophile only. Psychro means what? Psychro means low. These organisms grow at less than 20 degrees Celsius. Okay. Phile means to love or to have affinity or attachment for. Okay. Now, which amongst these three are going to be medically significant? That is the ones which are going to cause disease in us. Remember, it is mesophiles. Mesophiles are medically important or medically significant because they can grow between 20 to 40 degrees Celsius range of temperature, and human body temperature is 37. Thermophiles and psychrophiles are not medically significant. And what is the meaning of halophile? Halo means what? Salt. Phile means to love. Halophilic organisms, they need sodium chloride for their optimum growth. At least some concentration of NaCl is needed. Examples are the marine organisms, and the classical example of halophiles are members of the genus Vibrio. And the question which is asked over here is, name some non-halophilic Vibrios. Name some non-halophilic Vibrios. Thermophiles are the ones which grow at more than 50 to 60 degrees Celsius. Little bit variation in temperature you will get in different books. Some, yeah, you are, you're right. Some books do have mentioned 55 to 80 also, but little bit variation I have seen also in so many different texts. ठीक है, so basically 50 से ऊपर, more than 50 पे they usually पे they grow. Is this clear? The non-halophilic vibrios, these are, now please remember, non-halophilic does not mean that they don't need salt. Non-halophilic just means that they need little amount of salt. They need actually just 1% NaCl for growth. Lekin halophilic vibrios are the ones which which need up to 10% of NaCl for growth. Now non-halophilic vibrios, you want to know the examples? This is an important question. Okay, let me explain it by something. This I have included in the app also. Just wanted to show you a little sneak peek of what I've added in the videos. 1 second. Okay, guys. Okay. So who is this? So you can see this is an old fellow, uh, has got gray hair, bald also, and he's the CM. CM is मेड साइको. जस्ट गिव मी वन मोमेंट, अभी बताती हूँ साइक्रोट्रोपिक, उस पर आती हूँ अभी. ठीक है, साइक्रोट्रोपिक लिस्टीरिया, बस जस्ट गिव मी वन सेकेंड नाउ दैट आई हैव स्टार्टेड शोइंग दिस पिक्चर. So he is the CM and he looks so worried. And what is he doing? He is measuring his blood pressure. So he is an old aged fellow and he is the chief minister or the CM. And he exclaims, while he is taking his blood pressure reading, he explains, oh my god, my blood pressure is off the charts. I need to tone down my salt intake. Now, the examples of the non halophilic vibrios can be remembered as, remember vibrio. See, hypertension is a disease of the old age, and when somebody is hypertensive, the salt intake has to be less. So remember vibrio CM, chief minister, old aged, BP is off the charts, should be taking what? Should be taking low salt. So non halophilic, C for cholerae, okay, and M for mimicus. So the two important examples of non halophilic vibrios are vibrio cholerae and vibrio mimicus. In fact, vibrio mimicus was named as vibrio mimicus because it mimics the non halophilic properties of vibrio cholerae. Vibrio cholerae is what? It is the causative agent of cholera and acute diarrheal disease. Okay, so remember an old chief minister who is hypertensive, so less salt intake should be there. Less salt intake means non-halophilic. CM, chief minister, names of the species cholerae and mimicus. Is this clear? Okay, coming to the doubt asked by MedPsycho, psychrotropic. Good doubt, by the way. So thermophile, mesophile, psychrophile, halophile, I have told you. There is a word similar to psychrophile, but it is not same as psychrophile. The name is psychrotropic. Psychrotropic. Psychro means low. Okay, tropic means again tropism. Psychrotropic are the organisms which grow at 37 degrees Celsius, that is human body temperature, and also at a low temperature, that is 4 degree Celsius, at a low temperature, okay, and also at a low temperature. Okay, now the classical example of psychrotropic organism which you need to remember, let me write the name in blue to help you remember that it's gram positive. The name of that special organism, my most favorite organism personally, is this one only, Listeria monocytogenes. Okay, so it grows at, Listeria monocytogenes grows at both 37 degrees Celsius and a low temperature. How low? 4 degrees Celsius. L for Listeria, L for low. Okay, L for Listeria, L for low. Where is the temperature 4 degrees Celsius? It is the temperature of the refrigerator. We usually keep, we store the food in the fridge, in the refrigerator, so that it doesn't get spoiled. But this is one organism which can actually grow inside the refrigerator if it has contaminated any food item. Listeria is a saprophyte. It's omnipresent, just like God, it is omnipresent, and the mode of infection is ingestion. It's a food-borne pathogen, and it has got love or affinity or predilection to infect, to grow in milk and milk products like soft cheese. So it is going to cause a disease, namely, food poisoning or gastroenteritis. That is how it enters the human body. And after gastroenteritis mostly is self-limiting, but in some people it can cause deadly infections like pregnancy, neonates, geriatric age group, like that. Is this clear? Okay. Okay, next question, guys. Enrichment media. Yes, med psycho, of course it is going to spoil the food items also. It is going to harm us also. But touch wood, in most of the infected people, the infection is going to be self-limiting. There will be transient bacteremia after gastroenteritis. But if somebody is immunocompromised for some reason, like for example in pregnancy, if the infection occurs especially in the third trimester, then the organisms can go on, can cross the placenta and go on to infect the fetus. And if infection is occurring near term, the fetus can develop granulomatosis infantiseptica. Okay. मोस्ट वेलकम मेड साइको. ठीक है, चलो नेक्स्ट क्वेश्चन. Enrichment media suppresses commensal bacteria while allowing the pathogen to remain viable and grow. Which of the following is an enrichment medium? I mentioned this yesterday. Enrichment media are liquid media, so they are referred to also as enrichment broth. Alkaline peptone, water. Yes, the name itself has got water. It is an example of an enrichment medium. And for what organism it should be specially used? Vibrio cholerae, because it grows in alkaline pH. This I discussed yesterday. This again is an MCQ. Nothing I am talking is not an MCQ. Everything is an MCQ. 8.2 to 8.5. Okay. Now, Monsour's taurocolate telluride peptone water also is an example of an enrichment medium. So is selenite F broth. F means feces. F means feces. Sudhanshu, beginning itself meaning? Acha, when the app is getting launched, you mean? I will have to check it. I will have to ask the team the plan for rapid revision. Of course, for NICT, something is coming up for you guys, but I'm not very sure if it is going to be on the app. Most it should be on the app also. Okay. Okay, we'll update you on this. Okay. So the answer is all of above, all of above. And remember what I mentioned about enrichment media yesterday? They are like, traffic police, clearing the traffic. They are used for the fecal samples, the feces. When they are received in the lab, when fecal sample is received, it is going to have millions of commensal bacteria. The pathogens are going to be very less in numbers. So first we have to we have to tackle with the commensals by suppressing their growth, and that is what these media do. So we inoculate the fecal sample in the enrichment media, incubate for 6 to 8 hours only, not beyond that. Otherwise, the commensals are going to grow. Then after 6 to 8 hours, you inoculate the fecal sample from this enrichment medium onto a solid medium, solid selective medium. S for selective, S for solid. All selective media are solid. Okay. Sudhanshu, right now, this FMG accelerated program is running on the YouTube channel of PW MedEd, and in future, where the revision sessions are going to be taken, most likely should be on the app only. Okay, so we'll update you as and when the sessions are going to be announced. So you can find the description link in the you can find the links in the description of this video of different handles, the social media handles of PW MedEd, which you can follow for more updates. Okay. If you have any doubts, you can DM me also, okay, on Instagram. Is this clear, guys? All right. So next question, one of my favorite questions. In the small intestine, cholera toxin acts by ADP ribosylation of G stimulatory protein, inhibition of adenyl cyclase, activation of GTPase, or active absorption of NaCl. What is the answer? Okay, ADP ribosylation of G stimulatory protein. All endotoxins, the endotoxins and all the exotoxins are very very important questions. So the answer is option A. Answer is option A. Okay. Now have a look at this. Now imagine this is what? This is an enterocyte. Okay. So this is enterocyte, the target cell of Vibrio cholerae toxin, and it has got this sky blue colored receptor like this. Okay, so what is this? This is the GM1 ganglioside receptor. GM1 ganglioside receptor. R surrounded by a circle is receptor. Now the Vibrio cholerae toxin is an exotoxin. It is made up of two subunits. Subunit B, which is going to bind to the receptor, okay, and subunit A, which is going to be sitting at its head, on its head like this. And look at this, how how they are smiling, looking at each other as if they are up to something, they're conspiring against somebody. So who are these? This is the A subunit of the toxin, this is the B subunit of the toxin. And guys, please remember, this is one single toxin. Okay, this is one toxin only, not two independent toxins. Yesterday I mentioned about Clostridioides difficile. which has got two separate toxins, I said. And I told you also, please don't confuse the two independent toxins, A toxin and B toxin of C difficile, with with the other bacterial exotoxins, where most of the exotoxins have got two subunits A and B. Okay, so please remember this. Now, the B subunit is binding to the receptor, B for binding, okay, and B for also bahar. B also means bahar. Bahar is a Hindi word which means outside. So B subunit will be, you have to remember, it in two contexts. One, it is going to, of course, help in binding to the receptor, and A is sitting on its head. Plus, it is going to remain outside only. It will not enter inside the cell. On the contrary, once it binds to the receptor, it will push or inject the A toxin inside the cell. There's a reason why I have chosen the red color for the A toxin, or A, or active subunit, who is going to create all the disturbance. Now remember, A is a highly sadistic fellow. It hates people for no reason. It's a highly sadistic personality. And in the cytoplasm, we have got two best friends. Who are these best friends? One is NAD, and the other best friend is this yellow fellow. This is ADP ribose. And look at this, I have drawn them joined together. They are inseparable best friends. Okay, but their friendship ko nazar lag jati hai. The evil eye of A subunit is upon them. So when this evil eyed A subunit gauges at them, it is going to separate or create a rift in their friendship, so that NAD and ADP ribose now will part ways. Now NAD is emotionally very strong, so it will become indifferent. It will not bother much. It is emotionally very strong. So even if ADP ribose is no longer is there in his or her life, it will find somebody else. That's okay. Okay, so life is going to go on. Move on kar leta hai ye. Not a tough job. But ADP ribose is a very emotionally labile fellow, highly emotional. It needs some shoulder to lean on, to cry on. Now, RI in ribose, see, R for ribose, R for also Rona. Rona is a Hindi word which means to cry, So this is very vulnerable now. This fellow, yellow fellow, is highly vulnerable. It is crying, okay? But it is crying, and it is very sad. It is very upset. It needs some shoulder to lean on. So you see, even though we might meet bad people, unpleasant people in life, like the A fellow, the A subunit, there are good people also. Goodness still exists. I always believe that. And let me draw a good golden hearted fellow in the cytoplasm. And who is that golden hearted fellow? That golden hearted fellow is the G stimulatory protein, who is going to now unite or combine with the crying ADP ribose, and together now they will they will become inseparable. Now they will become friends. Acha, one more thing I forgot to tell you. N for NAD, N for neglect. So let us just neglect NAD for now, because it doesn't need anyone. Okay, see, there are different kinds of people have got different kinds of emotions. Not everybody is going to deal with the situation in the same way. So it's okay. Okay, 1 second, guys. Okay. Med psycho. Okay. Yeah, toxic relationship, ठीक है ना? So I was saying that different people are going to handle situations differently, because everybody is different, and everything is a perspective in life. So when this ADP ribose crying fellow, yellow fellow, comes and unites with G stimulatory protein, this union has been described in our microbiology books as ADP ribosylation. ADP ribosylation of GS protein, meaning attachment of a molecule of ADP ribose to G stimulatory protein, and together they are going to be so happy, super happy, that 1 second, let me enlarge the cell. I am running short of space. Okay. Now this whole complex, it is so hyperactive. So I mean, this is totally hyper. So together this complex is going to activate an enzyme in the cytoplasm. Mind you, all this entire story I'm telling you, it is happening in the cytoplasm of the enterocyte. Okay, it is going to activate the adenylate cyclase, enzyme, which in turn is going to convert the cytoplasmic ATP into cyclic AMP, whose concentration therefore is going to increase in this cell, and this increasing concentration of cyclic AMP, it is going to inhibit the absorption of sodium from the gut lumen, and it is going to stimulate the secretion of chloride, and water will passively follow, and the end result is going to be secretory D for diarrhea. Is there going to be pus or blood or mucus in the stool sample? No, because there is going to be only biochemical disturbance thanks to the toxin. There is no tissue damage happening, no tissue damage, so no inflammation, so no blood or pus cells or mucus in the stool sample. This is how Vibrio cholerae toxin is going to act. And exactly same mechanism of action, exactly same MOA is going to be seen with the LT, labile toxin of ETEC, that is enterotoxigenic E. coli. Is this clear? Clear, guys? Yes or no? Acha, Sudhanshu Ranjan, by the way, you are an FMG student. This is a FMG accelerate only, na? This is revision only. Is this clear, guys? Yes or no? Please comment in the chat box. Chalo, good. Okay, next question. Sporulation occurs in which phase of bacterial growth curve? Stationary phase, lag phase, log phase, or decline phase? So these are the phases of the bacterial growth curve. X-axis has got the time, okay, time on the x-axis, and on y-axis the number of bacteria, log number of bacteria. So we have got the lag phase. This is the lag phase. Then we have got the log phase or the exponential phase, the stationary phase, okay, the stationary phase, and the phase of decline. S for sporulation, S for stationary. So sporulation occurs in the stationary phase, occurs in the stationary phase. Okay, so in the lag phase what happens, see, let's say, this bacterial growth curve is, by the way, plotted when we add bacteria to a liquid culture medium and we see how it grows. So when we add the bacteria to a liquid culture medium, it is a favorable condition or unfavorable condition? It is definitely a favorable condition because nutrients are plentiful, so bacteria will start to divide. So let's say at time 0, I add 5 bacteria to the broth. But these bacteria, see, whenever our environment changes, whether we go into a new environment, which is good or bad, irrespective, we still take some time to adjust. If the environment is not that good, we'll take our own time to adjust. Okay, it will take some time. But even if the environment is good, then also, we'll rejoice, we'll celebrate for some time, and then we'll get down to our work. So in this case also, the bacteria which have been added to the broth, which is a good condition, a good environment, they will not start dividing right away. We expect them to divide, right, because we have provided nutrients to them, but they will not divide right away. So this is what lag phase is all about. So bacteria are trying to adjust. They are switching on all of their enzymes, which they can use in the further phases of growth, which they can use in their multiplication. And once that preparation is done, they enter the log phase or the exponential phase. As you can see, the graph is going up, and y-axis shows you the number of bacteria. So bacteria are multiplying. But the nutrients are limited. Some metabolic waste products are going to be accumulated. So some bacteria there will be competition, some bacteria will die. So a time will come when the number of living bacteria becomes equal to the number of dying bacteria. We call that stationary phase. And as time passes by further, there is going to be more number of dying bacteria than the number of living bacteria. That is known as phase of decline. So the unfavorable conditions are going to set in stationary phase, and sporulation or spore formation occurs therefore in stationary phase. Is this clear? Is this clear? Yes or no, guys? Okay, guys, next question. Identify the parasite as shown in this photo. So what you can see, this is a microfilaria, and what do you see? This is sheathed or unsheathed. It has got a nice sheath. Okay, look at this. I'm zooming the picture. It is sheathed, है ना? Now look at the tail end. Tail end, a very important area to be examined to comment which organism it is. So you can see tail is devoid of nuclei. Okay, look at this now. So is it Brugia or Wuchereria? Forget Taenia, Solium, Sarginata are they are too very easy to rule out. It is not Taenia. It is some filarial parasite. Now look at this. I have put up this diagram, this image. One second. So in case of Wuchereria bancrofti, look at this. There are no nuclei in the tail tip, and the tail tip is pointed. Okay, and look at this in this diagram. This is the tail end. This is the tail end. Are there any nuclei? There are no nuclei, and it's a sheath microfilaria. Okay, no nuclei. Now, in Brugia malai, now remember, B for Brugia, B for both. Both means two. So remember, in the tail end, there are two widely separated nuclei in the tip of the tail. Okay, and it is also sheathed. Okay, and periodicity is nocturnal. That is, the microfilaria are going to be maximum in bloodstream somewhere from 10 p.m. to 2 a.m. or 4 a.m. time, as like this kind of range is given in the books. Okay, now just a little tip. Let's say you buy BMW. I hope all of you buy BMW someday. Let's say you buy BMW, drive it at night only. Drive at night. Okay, in daytime there will be too much of traffic. There is a danger of more chances of the car colliding with somebody else. And this reminds me, by the way, of an episode from Sarabhai versus Sarabhai. Okay, I don't know how many of you are aware of that series. Very, very good series, freely available on YouTube. Okay, so there was an episode where the one of the characters buys a fancy car and insists on driving at night only, because he is so worried about scratches on the car or the car being damaged or some accident happening like that. Okay, so B for what? B for Brugia malai. B for Brugia malai, and W for Wuchereria bancrofti, both of which have got nocturnal periodicity. So BMW, drive at night. Drive at night. Is this clear? Okay. Then Loa Loa. Now remember, in case of Loa Loa, a column of nuclei is extending into the tail tip, and the tail tip is blunt. Loa Loa has got diurnal periodicity. This MCQ comes. Remember, DILL. Dil. In English it means heart. D for diurnal. LL means Loa Loa. Loa Loa. Small I have written because small I stands for nothing. It's a vowel. Ignore it. So remember Dil. D for diurnal. LL Loa Loa. Okay. Then Onchocerca volvulus. Now remember, the Onchocerca volvulus, it begins with O. O reminds us of zero, not the Shah Rukh Khan movie Zero, but zero in maths. O means absent. So remember, there are no nuclei in the pointed tail tip, and it is non-periodic, unsheathed. So absent features. No periodicity. It will be there in the bloodstream 24 hours. Not sheath is absent. Nuclei are absent. Is this clear? A vector of what? S. Oh yes, acha, you are asking about Loa Loa. Yes. Loa Loa ke, in case of Loa Loa, remember, the definitive host is man, and the intermediate host is, remember, Municipal Corporation of Delhi. Mango fly or chrysops or deer fly. Please do not confuse this C with cyclops. Cyclops is there in water. Chrysops is going to fly. So this is chrysops and not cyclops. When I say cyclops, what diseases should come to your mind? Cyclops is a freshwater crustacean. It is what? It is the intermediate host in case of what? In case of guinea worm. That is Dracunculus medinensis, and also it is an intermediate host of Diphyllobothrium latum. Okay, Diphyllobothrium latum. Okay. S. Did you get this? What I said about Onchocerca volvulus? Let the microorganisms only help you recall. Okay, I'll be the mediator. All right. So questions are asked on this only. Okay. The last thing, Manzanella, I have not seen any question, but I did not edit. I did not crop this photo just because it's going to be there in the PDF only. Manzanella is less important. You don't, I mean, I have not seen any question. I don't think it is going to be asked even. ठीक है ना? Just remember Manzanella, in case of Manzanella, it is unsheathed, ठीक है, and non-periodic, just like Onchocerca. Okay, that's all. Okay, guys, next. The diseases spread by the shown vector is all except. What is this vector, by the way? So the options are Kala-Azar. What is Kala-Azar? I mean, Kala-Azar is transmitted by sandfly. Sandfly. Oriental sore, again by sandfly. Also known as Delhi boil or Baghdad boil or Oriental sore, a kind of cutaneous leishmaniasis. Again, option D, same thing, only they have just written different words, sandfly. Okay. Chagas disease. Chagas disease is caused by Trypanosoma cruzi. Cruzi. It is transmitted by, remember, Redu-Witt bug. Redu-Witt bug. So the answer is option C, Chagas disease. And what is this? This photo is of sandfly. It's of sandfly. Okay. Redu-Witt bug, also known as kissing bug, because it usually bites on the face. Also known as assassin bug. Also known as triatomid bug. Alright. Trypanosoma cruzi. It's the causative agent of African trypanosomiasis or American trypanosomiasis. Cruise पे which people will go on cruise for their holidays? Rich people. America, relatively between Africa, America, rich people are in America. They will go on cruise trips. And Tom Cruise also is American. Okay, so remember, it's the causative agent of American trypanosomiasis. And then what we are left with? Trypanosoma brucei, which is seen in, which causes African trypanosomiasis. C for cruzi, C for Chagas disease. Okay, and you know, they have got so much of money, American, I mean, just a little memorizing tip. So they have got you know, a lot extra things. So remember, everything is going to be extra in cruzi. There is going to be cardiomegaly, mega esophagus, okay, mega colon, like that. Is this clear? All right. Okay, last question for the day. Identify the ideally it should be identify the agent. Okay, because this is the virus. Viruses are neither here nor there. They are neither living nor non-living. They are not cells. So the best terminology for viruses is obligate intracellular infectious particles. Acha. So which virus is this? Rabies we saw today only. It is bullet shaped. Is it rabies virus? No, it is not rabies virus. Now what about the other viruses? Coronavirus, reovirus, influenza virus. Let me zoom the picture. So what you can see? We can see a lipid bilayer envelope. Lipid bilayer envelope. Envelope is decorated with peplomers or proteins. Like for example, this blue proteins are heme agglutinin. Okay, this whatever color this is, maroonish color, is neuraminidase, and inside you see what are VRNPs, viral ribonucleoproteins. Meaning ribonucleoproteins are nothing but the proteins associated with the ribonucleic acid, and so all of these green things are the ribonucleic acid or RNA. And how many RNA molecules they have shown? 1 2 3 4 5 6 7 8. So it is what? It is segmented RNA, guys. Segmented RNA. Segmented RNA is seen in influenza virus. This is the typical structure of influenza virus. It's an enveloped virus. It has got H antigen, N antigen, also known as HA and NA. Both abbreviations are correct. Okay, it has got this non-structural protein or NS1, and of course the matrix proteins are there, M2 and M1. Okay, and so remember, segmented RNA, also known as segmented genome, is a feature of the following RNA viruses. Remember Bora, namely Bunia viruses, orthomyxoviruses. The classical example is influenza virus. Influenza virus. R is reoviruses. The classical example is rotavirus. Okay, and A is what? A is arena virus, not adeno. Adeno is a DNA virus. Yesterday I told you na, happy may A was adeno. It has got a D in its name. It's a DNA virus. Okay, arena has got anyways, you know, R and A in its name, because some students get confused ki what was adeno or arena. It is arena. Okay, So that's why I'm emphasizing on this. So remember bora, a segmented genome, and these RNA segments, they can exchange amongst the viruses, leading to, as rightly pointed out by Vignesh, genetic reassortment. And genetic reassortment, which is going to lead to major antigenic change known as antigenic shift, classical feature of influenza A virus. Influenza A virus, another MCQ. And antigenic shift is not seen in influenza B and C viruses, because influenza A virus infects not only human beings but also different animals also. Okay, so the animal and human viruses can mix, can exchange their RNA segments. If at all a human being gets infected simultaneously with a human influenza virus and let's say a chicken influenza virus, somebody is in close vicinity with chickens and the chicken itself is getting, has got infected with the chicken influenza virus. So being in close vicinity with the chicken, the human being can also get infected with the chicken influenza virus, and then RNA segments can be exchanged, leading to creation of a novel, altogether new virus. Yes, Dr. Gressel is absolutely right. Influenza viruses have got 8 RNA segments, except influenza C and D. They have got 7 segments. Rioviridae, rotavirus, 11 segments. Okay, Bunia and Arena, if you don't want to remember, that is okay, because nobody has asked that question. But rotavirus, yes, important. And influenza virus also is important. Is this clear, guys? So this is influenza virus. Is this clear, everyone? So, with this, I come to the end of the session. So, I have discussed 30 questions yesterday, and total questions are 56, 26 more today. The PDFs, annotated PDF of both today and yesterday's session, you can find on, remember, okay, the PDFs you can find on the PW MedEd app. You can see the link in the description of this very video. Okay, all the social media handles, please follow. If you have any queries, you can post them on the Facebook group. Again, tomorrow is a big day, 1st April 23, launch of the, I mean, content content launch on the PW MedEd app. We so all are very excited. I hope the same excitement we is there on your end as well. Okay, so it was a delight and a pleasure teaching all of you. For any queries, you can please get in touch with me. Please follow PW MedEd on all the social media handles. Please download the app, explore it. Okay, explore it. Yeah, definitely. Facebook Messenger. Okay, definitely. I'll check. Med Psycho tomorrow, 1st April, is going to be full of surprises for all of you. Okay, full of surprises. Okay, so full of surprises. ठीक है ना? Okay, so study well, guys. So remember, it's just I'm sure all of you are going to do well. Just keep a positive attitude, and sometimes even if you're feeling low, it's okay. It's okay. Feel low, just sleep off, do some meditation, or just just what to say, just vent out your negative emotions. It's not always possible to be happy also all the time. It's okay. It's completely okay. It's completely human. But then try to just get over it. If you need any help, you can seek help of whoever you are close to. So my point is, just keep working hard. Consistency is very important, and daily studying is way more important than any kind of motivation. Okay, so I would not want to give any kind of any long lecture on any kind of pep talk, क्योंकि मुझे लगता है, I personally feel कि discipline is way more important. Of course we feel nice if we are motivated enough, but just remember, if at all you're feeling low, just tell yourself why you started, and don't take too much of stress. Don't take too much of stress. The more calm you are, the better you're going to perform. You read in pharma na, ki sympathetic activity is going to decrease cortical activity. So it's okay if you are not feeling if you don't feel like studying on a certain day. It's okay, take a break, watch some movie, watch some comedy series on YouTube or Amazon or Netflix. That's okay. Give yourself a good break, and then recharge yourself and get back to books. Okay, so as I said, the maximum use of these sessions, today and yesterday's session, you are going to get if you revise it in the next in the next 2 3 days. Finish it off. Okay, finish it off. I've tried to cover most of the high yield things. I hope it helps you. And if you need any help from my side, you can connect with me also on social media. I'm most active on my Instagram handle, mj.micro. You can find me even on my Telegram channel and my Telegram group also. ठीक है. And for any, if you face any kind of technical difficulty or anything else, you can comment in the, you can put up a post in the YouTube channel, in the, what is that sorry, Facebook group of PW MedEd, and you can tag me. Okay, you can tag any of us faculties, we are active on the group. Okay, you can ask us doubts also there. All right. Oh, thank you so much, Vignesh. Big, I mean, it's a big compliment. Thank you so much. Okay, guys, so you have any doubts, I am here, will be happy to answer. S, acha, don't worry, S, I'll check Facebook Messenger. Uspe I'm a little less active, Facebook Messenger, frankly speaking, but now that you have mentioned, I'll definitely check the messages. Thank you so much, Med Psycho. ठीक है, तो बस I would just want to say, stay happy, and life is good. All of you are blessed enough to prefix the name doctor to your name, so you already are high achievers. All right. So this is just an exam. So I know it's a very important exam, but I'm sure keeping a calm mind and studying the relevant stuff and studying smartly with proper revision, getting your doubts clarified from the faculties, and doing the previous year questions is going to easily help you sail through. You will. Okay. Dr. Gracilis, yes, yes, we are going to conduct sessions for INICT also, and it will be shortly announced. Okay. And please, guys, don't forget, tomorrow, just check out the MedEd app. We would love to have your feedback. More content is going to be uploaded in the next few days, okay, apart from the one you're going to see tomorrow. Okay. Okay. Yes, yeah, that's a good book. Okay, guys. Honestly, such feedback actually inspires me also. When I see all the, all the nice comments, it makes me feel, it inspires me to make, to draw even more cartoons, to think of some new, more innovative stuff, so that I can help all of you, because your victory is my victory also. Okay. So if anybody doesn't have any doubts, can I call it a day? Most welcome, S. Okay, so on that note, I would say, once again, thank you everyone for your time and patience. Wish you the best for everything in life, not just academics, but everything. Everything is important. Okay, academics is a part of life, and you are going to do well in that also. But please don't ignore other aspects also. Family is important, friends are also important. So, a nice balance of different areas of life is very, very important. Okay. Okay, guys, once again, thanks everyone.